to undertake this role, and this was agreed by the Chief Executive of Falkirk Council and NHS Forth Valley, and also myself as Chair and Councillor Conley as Vice Chair. That as well. So thank you very much, Gail, for stepping in. I also have to let you know that Councillor Devine has resigned, and I'd like to thank Councillor Devine for her contributions and for the duration she was on this board, and that Councillor Devine will be replaced by Councillor Flynn, who's joining us this morning. So welcome, Councillor Flynn. Jack, I'm going to pass over to yourself, and perhaps you can share with us the other apologies we've received for the meeting this morning.
Thank you very much, Chair. Yes, so in addition to the apology you've noted from the Chief Officer, there are also apologies from Kenneth Laurie, Cathy Cowan, Andrew Murray and Francis Dodd, and I understand that when available, Patrick Rafferty will join us as a substitute for Francis Dodd.
That's great, thank you, Jack. Do we have any declarations of interest this morning? No? Okay, can I then just move us on to item 3 on the agenda, which is the minute of the meeting held on the 18th of November. First of all, I'd like to just simply look at this for accuracy, so if we can just go through page by page. So page 4, page 5, 6, page 7, page 8, page 9, 10, 12, it's a long minute, 13, page 14, page 15 and page 16, page 17, 18, 19 and 20. Look, I don't see any hands up in terms of accuracy, so we have to accept then that that was a true reflection of the last meeting. Yes, fantastic, thank you very much. That then takes us on to item 4 on the agenda. We're having a bit of an issue, I think, in here. Hopefully, I won't lose
just
you.
hit cancel.
It's cancelled.
One more.
No, that was great.
Ah.
Oh,
Oh, I'm so sorry. No, sorry, I should have done it.
not fast enough. Let's just continue with the meeting.
How do we get it back on? Because that's the thing.
David's
again. It must be David, yeah. Sorry, come on. Where are you, David?
I think they can probably.
David's not in today's meeting because he's.
I'm just not sure.
He's not in.
Right.
Right.
I'm not sure whether it's Jack, can you hear us?
Can anybody hear us?
Everything's
get
coming
Brian.
We
through
need Brian. Because
fine.
if I hit that, that'll just.
Yes, we can hear.
Unless I stop the meeting and start it again,
Okay.
is one possibility because that's the stop button. But actually, maybe
You press that button. I don't know if it's the screen that's just there.
it's maybe just the screen.
Yeah. Oh, let's see. You've switched to my phone, certainly.
Yeah. Sorry, I am challenged every time I'm using one of these.
Councillor Hannah and Chair, if I might just advise, Mr. Piddy will
Back on.
join you momentarily if
On.
that's of assistance.
Message came up on the screen
I'm
saying.
not sure
You
whether
know the
it's-
cancel okay because we didn't get there quick enough.
Let's see.
So I switched the screen back on. I didn't want to, I was going to switch that. Yeah.
We're still there. Jack, can you hear us? Are you still with us? Yes, Gail, thank you.
Yes, we can hear you.
So apologies. I'm supposed to now joke and say we're on item 17 on the agenda and you've missed the whole meeting, but I figured Colin wouldn't be so happy with it. So back to item 4, which is the action log. So, okay, there were 2 outstanding items in the action log, but I understand that both are being covered in the Chief Officer's report. So unless anyone has any questions or anything relating to one of the closed actions, I'm going to move on to the next item. Okay, I don't see any hands, therefore I am going to move on to item 5. So Gail, I'm going to hand over to yourself for the Chief Officer's report.
Thank you, Chair. So the Chief Officer's report today is, sorry, I'm getting feedback. I don't know if other people are.
No.
That's maybe it sorted. I'll start again. So the Chief Officer's report today is a very comprehensive report setting out the wide range of activities that have been happening over the intervening period since the last IJB meeting. I'll just go through the report in summary if that's okay. So the report starts out by setting out some of the systems pressures, and we are recommended that the delegated authority that is provided to the Chief Officer to ensure timely decisions continue to be taken in response to the ongoing systems pressures continues. And again, that will be reviewed at the next IJB meeting. As part of the system pressure response and in relation to NHS Forth Valley being in stage 4 escalation, we do have weekly cross-system performance meetings ongoing. These meetings include the 2 chief officers, key individuals within both partnerships and NHS Forth Valley, and we meet monthly with the 4 chief executives from across the system. We have been progressing a recruitment campaign. So one of our key challenges in relation to systems pressures is around our staffing availability. So over the last few months, we've been progressing a robust marketing recruitment campaign. That campaign has, we're pleased to say, resulted in quite a degree of success so far. So we are seeing an increase in the number of applications for the role of personal carer, around 3 times as many applications being received each week than previously was the case. And also we're seeing that the successful application rates have improved, with on average 3 applications that come in, leading to 1 successful candidate hire. So that's we're really pleased about that, and that is helping us with our systems pressures, particularly around our staffing availability at the moment. Section 5 in the report outlines our progress towards integration. So as members will be aware, the primary care services and out-of-hours services and health improvement services came over to the Falkirk Partnership as of the 31st of January. Work is still ongoing around the due diligence of that, and we are going to be receiving some capacity supports to support with that piece of work. We are still working out the detail in terms of the governance arrangements, in terms of the oversight to make sure we do have effective systems in place to support those services to be delivered well in the coordinated arrangements. Section 6 outlines a number of health and social care partnership service updates. So firstly, we're given an update on the transfer of the interim care team. So this is a team that was set up by NHS Forth Valley in response to systems pressures. It provides interim care for people who need to go home, but their longer term package of care isn't yet available. Following a meeting with Scottish Government, it was determined that a partnership would be the most appropriate place for this service. And we're going through a process where we anticipate a decision will be taken that this service will be fully within Falkirk, supporting Falkirk residents. We'll give you further information on that as that progresses. We've been doing an exercise across the whole system called Reimagining Care Closer to Home, and that's around pulling together a wide range of intermediate care services to support people at home or enable them to return home or a homely setting at an appropriate time. So the events at the moment have included a wide range of service providers, including the third sector, to seek opportunities for closer collaboration and to help people get the right care in the right place at the right time. There's been 5 priority areas that have been identified through the process so far. These are falls, pathways and frailty, addressing the deconditioning of inpatients and anticipatory care planning, better access to information and IT systems, access to services with fewer and simpler points of access, and out-of-hours service integration. And again, we'll give you further updates on this as that programme of work progresses. There are also updates on the Home First service redesign, the support at home services contract. The current contract is due to end on the 31st of March, and the Chief Officer's report sets out the next steps and the interim arrangements that we put in place for that. In addition, there's information about the registration of Thornton Gardens Care Home. As colleagues might be aware, we currently have a variation to the registration with the Care Inspectorate for Thornton Gardens. That's due to end on the 31st of May. The Care Inspectorate has advised that we need to make sure that we're not providing for younger adults and older adults in the same care home. So we're currently undertaking an options appraisal for Thornton's Gardens to agree the appropriate registration going forward. Given the timing for this will be in place in advance of the next IJB meeting, we are asking for delegated authority to the Chief Officer in consultation with the Chair and Vice Chair to agree the proposed next registration for Thornton Gardens. There's also an update on the care home framework for adults and an update on capital planning. So some colleagues will be aware, and there was a communication sent out last week that as part of the Falkirk Community Hospital Master Planning exercise, the Scottish Government has advised that there's a different process will now take place. So it was intended that we would now move to initial agreement stage, and we've now been asked to integrate this across Forth Valley into a whole system plan for the Forth Valley area. In addition to this, at the council budget meeting in March, it was acknowledged that the 3.7 million that was in the council's capital programme was unlikely to be sufficient for an intermediate care facility. It has been removed from the capital budget in the council, and colleagues will work together to pull together a business case to bring back to council. So that will pull together some of the work around the Falkirk Community Hospital Master Plan and the intermediate bedded care facility. Other work is ongoing that is related, for example, the development of Cunningham House that IJB received an update on last time, and exploration of the development of Living Well hubs. There's also an update in the paper around the alcohol and drugs partnership and the proposal for structural review within the ADP. And also there's an update on the Mother and Child Care Recovery House. So this relates to discussions that have been ongoing since December last year with Aberlour Children's Charity about the proposal to deliver a second national mother and child care recovery house in the Falkirk Council area. So this is in response to a significant number of Scottish drug deaths and limited specialist mother and child residential house placements in Scotland. So Aberlour Children's Charity is working in strategic partnership with the Scottish Government around this. There's not anticipated to be any funding responsibility for the partnership or the council, as the initial costs will be met by the Scottish Government and Aberlour Children's Charity after that. The board is, however, asked to note that the proposal has been received with support in principle from partners, and that further discussions are ongoing. There's also an update on the care opinion implementation, which is due to launch on Monday. There's an update on annual health checks for people with learning disabilities. And the new guidance that have come out in relation to the provision of equipment and adaptations. In section 7, there's an update on NHS Forth Valley. NHS Forth Valley, as colleagues know, is in stage 4 of NHS Scotland's National Performance Framework for Governance, Leadership and Culture. There is an assurance board that is meeting every 2 weeks, and improvements planning and implementation work continues to be ongoing, and there is further information on that within the report and through web links in the report. Section 8 outlines a work on a strategic plan, and you do have in the papers today the proposed strategic plan for consideration. Also, section 9 considers this carer strategy, and again there is a separate paper on the agenda today. The section 10 covers the public sector equality duty, and again there is a paper on that in your pack today. And section 11 provides an update on work ongoing in relation to the National Care Service. We are aware there's a delay, or it's been extended. Stage 1 has been extended to the 30th of June, and we're awaiting further updates in relation to that. Finally, section 12 gives a brief financial update, and there are a number of papers on today's agenda covering our financial position. So just to go back to the recommendations in the report. So the recommendations are that the Integration Joint Board is asked to agree to continue to delegate authority to the Chief Officer to be reviewed at the board meeting in June 2023, to delegate authority to the Chief Officer in consultation with the Chair and Vice Chair to agree the required changes to Thornton Gardens Care Inspectorate registration, and to note the Aberlour Children's Charity proposal that's received support in principle from partners, and that further discussions are ongoing. I'm happy to take any questions. Thank you.
Gail, thank you. Do we have any questions for Gail this morning? one in the room?
Thanks, Gail. It's a very, very comprehensive report, and there's some good things there, particularly the Aberlour project and care opinion. I think that's going to be very useful for us. I just wanted to ask about the care home framework at 620. Is that going to be a Falkirk framework, or has consideration been given to it being a Handful of Valley, given that I'm sure whatever the issues are that need a local framework are probably similar in Clacton Stirling, and given we have an integrated service around autism, mental health, disability, etc. Now I just wondered whether that would make sense, whether thought had been given to that.
Through you, Chair, I was wondering if Martin Tom might want to come in on that as he's leading that piece of work.
Thanks. It's a Falkirk framework. At the moment, the councils tend to operate in their own individual frameworks based on the local needs for their population. So it's the same issue, I guess, we have for our care at home framework. That's a Falkirk-based framework that's led by the council, and each council tends to have different requirements and agree different rates. There is no national framework that would cover the whole host of services for younger adults. Much the same as our care at home services. Again, there's no national framework there, so each authority tries to negotiate in the main the best rates they can get, and the services need to be really specific, linked to the services that they provide through their in-house services too. So we find real variation across the country actually because of that. There are some benefits to having a much broader framework, but there are also a number of disadvantages as well. And I guess for me, one of the real benefits is it allows you to really focus in on what you need in your specific areas. So, for example, we know that population needs in Clackmannanshire, for example, are slightly different to those in Falkirk in relation to services provided through the ADP, for example. We seem to have more issues around drug-related deaths and drug use in Falkirk and Stirling, and we seem to have more issues in relation to alcohol use in Clackmannanshire. So I guess the fact that we're able to really tailor services and our request of services on that very local footprint is actually a big advantage to us. That's not saying that where there are advantages to Forth Valley wide commissioning, we wouldn't consider that, but at the moment we're focusing on really what do we need for Falkirk. Ideally, we would have been able to enter into a framework through Scotland Excel, for example, at a national level, but they don't cover all the client groups at the moment for that younger adult age group, and that's why we're looking at that really local solution. So hopefully that gives you a bit of background to why we're looking at that, but happy to consider anything going forward really that would improve services across the Falkirk area. It is very early stages in the work. We're looking at the options, and we are going to be looking at, I guess, developing a framework that's right for Falkirk. And if through those consultation and engagement events we find that there's a better option, we'll obviously pursue that. Hopefully that gives you an answer. Thanks.
Yeah, it's very helpful. Thank you.
Okay, thank you, Martin. Okay, we've then got Frank Donnelly.
Yes, can I come in? It's wrestling about Thornton Gardens, the respite for people with learning disabilities. Now you're talking about the age group on that. Well, they go on service in there goes from 18 right upwards, but they're doing a mixed care in there. Sometimes it's actually people waiting for discharge, well, getting discharged out of the hospital, but just waiting to go either to a home or go back home themselves to when places being fitted up. The other part about Thornton Gardens is, as a respite, it doesn't function really right for a respite in a sense. The reason because the people that go there are kind of locked in there. They don't get out. They stay in there all week. A lot of people will not use it. Carers will not use it. The reason being because if they've got they're looking after somebody who's got mental health problems, and that just being enclosed in that place for a week and not getting out, there's too much problems, so they will not use it. The other thing, I do not know why they do not tie up the day centre with Thornton Gardens just now to take people out from Thornton Gardens and take them to this day centre for a day and back to Thornton Gardens. All that can be done is actually getting picked up with the bus, but the bus will not pick them up to take them into the day centre while they're in the Thornton Gardens. Now that can be done just now, dead simply change, but these things are not getting done. And carers are needing respite. And this is not happening. Thank you.
Okay, thank you. There's a few things there you've raised. Gail, can I come back to yourself, and obviously you can pull Martin and answer some of that if need be. Martin, you've got your hand up. Are you jumping in there? You're going to come in? Yeah.
If I could come in first, I guess for me that's part of the reason we're having to look at the registration, because you're right, originally the agreement was that it would be a respite short break facility for younger adults, and it would directly replace a service provision that we already had in place. However, throughout the pandemic, it's been used for a number of things to actually help maintain flow in the hospital and to provide an increase in emergency short break placements for people with a whole range of issues. And we've used it in a very different way, I guess, since the start of the pandemic. So part of the work really is to look at what is the registration we need for that facility to get it operating as it should have been. Picking up your point around the transport in the day opportunities, I have to say that's the first I've heard of that, so I'll have to look into that following this meeting. But I guess thanks for raising it, because I wasn't aware that that was an issue. I think our expectation was that people that went into that facility for a short break were still getting the same service. However, the service user group had been a mix, and that was in itself creating some issues in terms of the numbers of staff and things that we need to provide those services. So I will look into that following this meeting. But I suppose the assurance really is the reason we're looking at the registration is actually looking at what is it we need in terms of going forward, really conscious of the decision that the board made previously around increasing the capacity for younger adults respite short breaks. And I do really acknowledge that carers have been under extreme stress throughout the period of the pandemic and since, because we are still not operating in a way that we would ideally want to, or indeed in the way that we were prior to the pandemic, which is why that work's really important. The fact that the Care Inspectorate have asked for us to be really clear around what our requirement is within a relatively short period of time, actually, I think will help change that service for the better. Hopefully that gives a bit of background to that. Thanks.
Martin, thank you. Frank, do you want to come back in on that?
Yes, Martin, the sticking point on the day centre is transport. Transport goes past Thornton Gardens. And that's really the second point. If that transport can get fixed out, then I don't see any reason why that shouldn't not be, but we go ahead. At least take some people out during the day, because respite is not just for carers. It's for the people that go into respite. They should be getting some things happening so they can make the time in respite enjoyable and not go back home to the carer and stress them out because they had a bad care service. You see where I'm coming from?
Yeah, I absolutely agree with that, and that's why I think it's really important that actually we define once and for all what we expect from Thornton Gardens. I will pick up their share in transport, because I agree, I agree with your points. It's not only about giving carers respite, but actually it's about giving our service users a really positive experience and I guess a break themselves from the normal routine. It shouldn't be a case of people are taken into a facility and kept there. The whole ethos, I guess, for me around day opportunities is really to promote that social inclusion, that development of links within communities, not to isolate people in a building. So I will definitely pick that up and look at the transport issue following this meeting. Thanks.
Thank you, Martin, and I know we'll see an update on that at a future meeting, so thank you. I would like to invite Councillor Hannah next.
Thank you, Chair. Not sure, Gail's screen seemed to freeze there for a minute. I'm not sure if she's still there.
I think she
I
might be
think
back.
she's back. I think Helen's screen's frozen too. We do appear to be having some technical difficulties. It very good report. Thank you very much, Gail, for this, and thank you for filling the big shoes of Patricia so well in her absence. I'm interested in and really pleased to see that there's been some improvement in the level of recruitment. That is really positive, and the figures that you're reporting there in your report is very, very encouraging. But can I ask, is the rate of recruitment bringing us up near to the as near to the 100% as we would hope to be, because clearly that's been an ongoing problem, the lack of staffing. Is Gail there?
Yes, I'm here.
Yeah.
Thank you. Yeah, so we are seeing some positive improvements as a result of the recruitment campaign. We're still very far off being at 100% recruitment. But I suppose what this does show is that this different approach is helping us as another approach amongst one of many to help improve our recruitment impact. But we are not nearly at 100% yet. We still do have significant gaps. Particularly in terms of home care.
Thank you. Well done. More power to your elbow.
Yeah. Okay, thank you, Councillor Hannah. And last but not least, Councillor Cole.
Probably just one is a comment around the Mother and Child Care Recovery House, and just fantastic to see that being developed in the area. We're really pleased to see that. I've actually had one question, but I've now got a second one. I've got a second one just in relation, not really a question, but a comment around the Thornton Gardens. And I think the opportunities to link in with the local community. You know, there are community facilities, and there's a lot of groups going on at the community centre as well, and it's accessible. So there's opportunities to link in with that as well to make respite breaks as positive as possible for individuals. So that was just a general point. I had one question, which was on 6.52, was around the pilot approach regarding health checks for people with learning disabilities. And I just wondered, obviously that's a pilot, when are we expecting that to report and develop the model for rolling out? Because I was talking about the delivery model for full implementation. I just wondered about what the timing and that was looking like.
I'm just wondering, would you like me to come back in on that one?
Yes, please. Sorry.
Okay. Yeah, so the pilot is ongoing at the moment through till the end of March. So following the pilot, we will review the impact of that, and we'll consider a report on what the proposed next steps are for that, so we can keep you updated in future reports in terms of how that's progressing. But we don't have the outcomes of that available yet.
Thank you, Gail. Councillor Cole, are you satisfied with that?
Yeah. I think it's just sort of, I suppose the time scale for progressing work. Obviously, you don't have the information yet, but I just wondered if there was something indicative going forward about, if the outcomes are March, would we expect something near the end of the year, or but I understand that to review what comes out of it.
Again, we would expect an update at a future meeting now. Okay, thank you, Gail. Okay, this paper requires decision, so if I can take you back to section 2. I see there are no further hands up, sorry, I should have said that, rather than just ignoring colleagues. If I can take you to section 2, the recommendations, are the board happy to approve recommendations 2.1 to 2.3? Thank you very much. I see no one saying no, so Gail, thank you very much for that report. Okay, that takes us on to item 6 on the agenda, which is the 2022-2023 finance report. I'm going to hand over to Stephen Kirkwood for that this morning.
Thank you, Chair. So this is the first of today's finance report, and it's current year 2022 23 finance report providing a summary of the year-to-date position as at 31st of January and a forecast outturn position for the full year. Section 3 of the report tracks how the annual budget has changed since the previous board report and notes a £4.487 million budget increase. Table 1 outlines the main movements split into additional in-year funding allocations, budget environment and transfers from reserves. The revised budget requires revised directions to both Falkirk Council and NHS Forth Valley, and these are summarised in Appendix 1 at the end of the report. Finally, in terms of Section 3, 3.4 notes that some final tranche budget allocations are still outstanding from Scottish Government. These have since been confirmed, but it should also be noted that any PCIP funding that we carry over into the new financial year will be offset against next year's funding, so it won't be additionality and won't give us any extra development scope. Section 4 of the report focuses on the year-to-date financial performance, where we are reporting an underspend of £2.243 million against the integrated budget and an overspend of £3.788 million for the set-aside budget. The position summarised in Table 2 and added context is provided in sections 4.2 through to 4.9. Just want to highlight a couple of points, if I may. Section 4.3 notes the ongoing requirement for due diligence. Gail touched on that in the Chief Officer's report, following the transfer of medical staffing into the partnership. Section 4.5 references risk share arrangements. There's a considerable overspend for primary care prescribing, for primary care as a whole, rather, very much linked though to primary care prescribing. And there's a considerable underspend for community healthcare services, which is mainly linked to the ward closures at Falkirk Community Hospital. 4.10 refers to progress against the savings programme, and while progress has been hampered by capacity challenges, those same factors have resulted in vacancies and associated pay underspends, so the integrated budget is forecast to underspend despite delays with the savings programme. Table 3 summarises the position with further detail in Appendix 2. Section 5 of the report notes the position with COVID funding, winter pressures and other developments. The Scottish Government has now reclaimed COVID funding per the intention previously notified to the IJB board. A final adjustment may be expected post year end to adjust for any residual movement in COVID costs. In terms of the other developments, we covered them quite extensively last time round, so I haven't said too much in this report. That brings us on to Section 6, year-end forecasts. Table 4 sets out the position. We're anticipating an underspend against the integrated budget and an overspend against set-aside. That overspend will be managed by NHS Forth Valley. Section 6.3 notes the cost share arrangements for the contingency beds in Stirling Community Hospital. 6.4 notes the expected short-term increase in general reserves at year end. And section 6.6 refers to a late out-of-hours adjustment that we are no longer expecting. So at the time of writing this report, we expected further costs to come through, but it's been confirmed that that won't happen. Just brings us back to the recommendations. The board is asked to approve the breakdown of the payments to both Falkirk Council and NHS Forth Valley, as per the direction summary provided in Appendix 1. To note the year-to-date overspend of £3.788 million against the set-aside budget and the integrated budget underspend of £2.243 million as at the 31st of January. To note that risk share agreement arrangements have been agreed for the current year only, and that the forecast set-aside overspend will be managed by NHS Forth Valley, while the integrated budget is forecast to underspend by £2.119 million and will not require risk share intervention. To note that longer term risk share arrangements required to be agreed as part of the ongoing review of the integration scheme. Finally, to note the cost share arrangements for the contingency beds study.
Stephen, thank you very much. Okay, I'm going to open to questions. Does anyone have any questions or comments on this paper? David Heron.
Yeah, thank you for that paper. I was really going to make a comment around section 4.6 and 4.7. As you know, GP services and access to appointments is extremely hard pushed at the moment with a hospital in escalation. It puts extreme pressure on GP services. So it is disappointing to me to see a £400,000 underspend on primary healthcare services this year and a £3.5 million underspend on community healthcare services. And I suppose my question is, how do we ensure that we're more responsive next year to changes and that we ensure that we don't have an underspend in these areas? Because these areas are the ones we should be putting extra funding in, because I think it's really important to the people of Falkirk that they have access to primary care services, and I think they're struggling, and that's because we are struggling from a lack of investment, and we can't provide the staff and the services that the people of Falkirk need. And then we see a budget that shows an underspend. The other thing I just wanted to point out, and I think it always comes up in these reports, is primary care prescribing always comes under primary healthcare services. And I understand why that happens, but I think that's most unfair, because primary care prescribing is not prescribing from primary care, it's whole system prescribing, and it's very affected as well by supply issues and national issues that change the price of drugs. The drugs can go up 6 times cost, for example. So it does come under primary care, and I understand why, but it's most unfair to attribute that to primary care. That's a whole system prescribing issue. But yeah, how can we avoid these massive underspends next year to provide more services to the people of Falkirk? Thanks.
David, thank you. Stephen, is that one for me to answer?
Yeah, yes, please. So David, I fully understand and appreciate your frustration with any time we underspend. That's an opportunity to use resource, and clearly where there's an underspend and that resource hasn't been fully used. What I would comment on is a lot of the underspend links to staffing and vacancies, and we've already had the discussion about the recruitment challenges. The most significant part of the underspend is in respect of Falkirk Community Hospital and the ward closures, and we have brought papers to the IGIB board previously where we have outlined exactly how we would like to spend that money. We have started on the process with the slow stream rehab. We're in the process of trying to appoint a bed care manager. There are various developments, but they take time to implement, and so there has been slippage. But it's not that we don't have plans for those monies. We've got plans for all of the development monies. It's just that it does take time to implement, and it's been more challenging during this time where everyone is stretched, where we don't have the levels of staffing that we would like. We don't necessarily have the capacity to do these things at full throttle. So absolutely, we want to use all the money that's available, that's at our disposal, but some of this is more a timing lag, and certainly where the opportunity exists, both through the financial planning and through the strategic plan and through the IGIB board, we are looking to spend these monies and spend them wisely to help with the whole system problems that we are facing. In terms of primary care prescribing, I take the point too. It is full system prescribing, so it's not just the GPs that are prescribing. There's care home prescribing, there's district nursing prescribing. It's the prescribing for all the scripts that you take to your community pharmacy, and they can come from a range of different people. The issue, the short supply issues we're faced this year are quite considerable. And I believe there are plans for one of our lead pharmacists to come to the SLT, possibly. We may have not spoken to Gail or anyone about this, but that might be a helpful session to bring to our board development session too at some point, just to tease out some of the huge short supply issues that have arisen in the past year. It's not unique to ourselves. All the IGIBs and health boards across Scotland have experienced these same short supply issues. every year, and we'll see that later when in the next paper when we look at the business case, we factored in 5.5% uplift on a prescribing budget because of volume growth and there's a price growth, and 5.5% might not seem enough, but in the context of the budget uplift we've got, we are trying to prioritise putting money into that area. Is it the same as GP services? No. Is it the same as dental services? No. There's a group of services within each of these heads, and it's because we're looking at quite a high level report here, but there is a lower level analysis, and hopefully it does tease out in the narrative that actually the main issue is primary care prescribing and not the rest of the primary healthcare system. And it does note that there's GMS out of hours underspend, although they're at the margins compared to the prescribing overspend. Hope that covers your points, David.
Well, yeah, I mean, you have explained it, Stephen. I think there is an underspend, and staff that have been failed to recruit is ultimately services that are not being delivered to patients. And I think I would like to see us be more responsive to that, and also look at our risk-taking strategy here. We know there'll be an underspend, so let's recruit far higher. And if we're failing to recruit, let's look at rediverting that money to other things that can provide services to patients in a quicker way to get to actually, fully deliver as much services as we can, rather than sitting on an underspend going through into the next year. So, but thank you. Yeah, I think you've explained the situation. Thanks.
Okay, David, thanks. I wonder if this is something that ought to be picked up outside this meeting as well.
Yeah, well,
we take that as an action.
There will be on the agenda later, there's a medium-term financial plan.
Okay.
And part of that will be the opportunity to try linking in, well, to have a full development session post today.
Yeah.
And part of that should be about linking the strategic plan with the workforce plan, with the medium-term financial plan. It does touch in the recommendations on due diligence too, but there is this piece of work about how we use the money effectively. David touched on over recruitment there. We've actually been trying to do that. We've done that for a few years now with the primary care improvement plan. We're trying to over recruit to other areas, trying to be pragmatic, but perhaps there is more that can be done, so we welcome that opportunity for further discussion.
Okay, thank you, Stephen. Councillor Flynn.
Yep, thank you, and hello to everyone, and I'm delighted to be on the IGB board today. My question or points relate to 4.6, the overspend of 1.79 million. I just wonder a couple of questions. Maybe the data is available somewhere, but I wonder what percentage of that 1.7 million is due to the prescribing of non-formulary drugs, because obviously that is a factor within it. And also I'd be really interested to know, not necessarily the names of the practices, but how many practices, because clearly across primary care, not every GP practice is in an overspend situation because they don't historically do that, And the other thing is as well, I do agree with David, the market fluctuation in the price of drugs on the market can be quite significant. And I remember an occasion quite a number of years ago where 500 aspirin tablets were costing in the region of £300 or £400 for a pack, and they were only sourced from somewhere like Hungary or that, But by the same token, and I don't know the answer to this, is that when drugs, as you know, come off patent, we benefit by these drugs becoming generic. I just wonder, in the last 12 months, what drugs have come off patent and what the net benefit of the cost savings related to that. I hope that all makes sense, Chair. Thank you.
It does, Councillor Flynn. Stephen, is that something we can answer today, or is it something that requires some further investigation?
I will try to answer it in part at least, okay. And if that's not enough, Councillor Flynn, I'm happy to follow up further. So in terms of the sort of practice variation in spend, there are groups internally within the organisation where we try and produce quarterly reports that compare the cost per item for all of our GP practices. It's actually done not on just a Falkirk area basis, but actually on the full Forth Valley wide basis to try and understand how much by practice we are spending on drugs. It's quite a challenging exercise because the volume of drugs that go through every month is significant. So it's not one that we break down to individual drugs. We tend more to focus on a cost per item. We tend also to try and strip out some of the high cost, low volume drugs that could cause variation for individual practices. And typically we will see that there's a natural difference between practices. Some of our rural practices, particularly in the Stirling area, will more likely have a higher cost per item than our other practices, just because of the different volumes and the different mix there. But it is an analysis that is taken through the Primary Care Medicines Resource Group. It's shared, I won't say how readily it's shared with GP practices. It should come through that group first, and then it should go to the GP subcommittee, so that there's a level of scrutiny over the drug spend. The question about the off-patent and generic drugs, again, our pharmacy colleagues do receive intelligence about drugs that are likely to come off patent in the near future. And in the past, there have been some sizable benefits gained from switching to off-patent generics rather than the more costly original drug. That tends more to be on the secondary care side, where in terms of the acute services, where there's a large spend that goes through our sort of daycare in particular for some of your medical specialties, and that's where some of the big savings have been generated in the past. In terms of other non-formulary and other approaches that we're taking further on in the agenda, well, I guess in this paper too, in terms of the savings, but perhaps more in next year's business case, you will see some of the other proposals that are being planned for the year that we're about to move into in terms of trying to deliver savings. Our pharmacy colleagues and our GPs try and work together on this. In terms of our pharmacy colleagues have been trying to look not at everything at once, but to focus on particular specialties. So there was quite a bit an in-depth exercise done last year looking at our respiratory formulary, the respiratory chapter, and trying to understand, well, here's the range of drugs, here's the most cost-effective ones. First and foremost, the first driver is to make sure that the drug works for people. But assuming that you can get an alternative drug more cheaply that has the same effect, then there is currently plans, or there are currently plans in the current year to do a prescribing improvement initiative with our GPs around the whole respiratory formulary, and to see switches where people are using one particular product to move on to another product. Where someone new starts using a respiratory medicine, then we would expect them to be using the recommended drugs. But for people who were already on a particular drug, where a switch is required, sometimes that might be a simple case of writing out to someone and advising them they're switching from product A to product B. Sometimes it's more complicated. Sometimes there's a need to do blood tests to make sure that the toxicity and things like that. Apologies, I'm going into too much detail now, so I'll stop at that. The message though is that there are different pieces of work being undertaken to try and make sure that we maximise the benefits from our budget. It's a big budget.
Thank you very much for that, and I look forward to maybe getting more detail as you explained earlier on. I'm well familiar with all that you've discussed actually, and certainly the switches, because I did work with a pharmaceutical company a number of years ago that, funny enough, was very major into asthma product, inhaler switches, etc. So I'm quite familiar with the process and that and how it works. So thank you, Chair, and thank you very much indeed for that answer. Thank you.
Okay, thank you. And next on our list we have Stephen McAllister.
Good morning, Chair. Thank you. Probably not one for just now, but maybe for a future debate is, and it's following on from David's point, maybe encouraging or facilitating the use of devolved budgeting within primary care. I think there's some evidence that if you put the finance nearer to where it's needed in the hands of local decision makers, it will get used effectively. I can see David Noddy saying, I'm sure if you'd given David and his practice a couple of £100,000, and I understand where the underspends come from, and we're a little bit behind the ball in relation to getting it out there. But I think if you get the money locally, you know, those who are charged with delivering primary care will use it effectively. So I think as we go forward, I know the business case is coming up, maybe for a seminar later on in the year. I'd really like to see us at least trialling devolved budgeting into primary healthcare. Thank you.
Thank you, Stephen. I don't know if there's anything you want to come back on in terms of that, Stephen.
I'm not sure actually. I think that's probably a conversation we need with David and Scott Williams and others. Obviously, in terms of primary care, we have GP practices and they are independent contractors. They largely manage their own budgets. There is a group that looks at enhanced services, and that's perhaps one area where there's scope to influence future performance and improve efficiency. But yeah, I'm happy to actually have further considerations with David. I guess through the primary care improvement plan, again, there's maybe more of that locality focus, and certainly GPs, there's practice quality lead, there's cluster work, so there's probably quite a bit there already. The primary care's just come into the partnership, I guess, at the start of this year. So I think there's a huge opportunity, and I know Patricia was keen for it to come into the partnership. There is a huge opportunity for us to align our services better at locality level, to work with GP practices, with district nursing and all of our other community services, to drive forward efficiencies and improvements for our service users. But that's kind of a high level response.
No, absolutely, like you say, it's sort of early days in that respect. Okay, last but not least, Councillor Hannah.
Thank you, Chair. It's also partly kind of following on from David's point. It's looking at the out of hours underspend. Clearly, out of hours service is one of the services that really does impact on pressures on the hospital, and it's also one of the things that our constituents regularly complain about. My recollection is that as part of the integration, the improved integration, there will be changes in that situation. Will that resolve that issue?
So I don't know too much about out of hours, but I'll share what I do know, because it's a service that's been managed through acute services and it has just come over. But for many years, out of hours service has been a service where we have struggled to get the sufficient capacity in our 3 out of hours centres, and most weekends have been a real scramble to try and make sure that we've got adequate staffing cover to support the needs of the area. There has been quite a bit of work done just in the last couple of years, but that's the bit that I'm not so familiar with, where Donna Clark in particular has led on improvement works. There has been Scottish Government investment. There has been the Sir Lewis Ritchie review of out of our services. Well, that's a few years back now. So there's quite a lot of focus, because the issues we've got here are not unique to us. It's not attracting GPs to working out of our service to the same extent. So I know some of the work they've done locally is to look at multidisciplinary teams where there's more advanced nurse practice engaged in the out of our service, so that we've still got that spread of staff to support. And I'm just trying to recall some of the stuff that Donna shared with us previously. They've looked at different ways of working too, so that instead of a GP and a driver going out to visit somebody in their own house, then perhaps someone else can go out and visit somebody in their house, take the basic measurements, do the health checks, feed them back to the GP, and then the GP can prioritise better which calls require that urgent assistance. So there has been quite a bit of work done, but the underspend reflects the fact that actually there's a real challenge getting enough GPs onto the rota for sectors.
Absolutely. We had a similar discussion. In fact, I asked the question that the health board meeting earlier this week on that. Gail, I can see you've got your hand up. Are you going to come in and share a little more in respect of this?
Yes, Chair, I was going to. Yes, so out of hours is one of the services that came into the partnership as of the 31st of January. So it is now coordinated by the partnership on behalf of Forth Valley. That is a work in progress, as I mentioned earlier. So I do understand that there has been significant challenges in terms of filling shifts, etc. There is a huge amount of improvement work underway in relation to the primary care out of hours services. So some of what Stephen's mentioned in terms of a test of change around healthcare support workers working as part of a team and undertaking some of the visits overseen by clinical leads. So that work is ongoing. Also, I mentioned earlier as part of the Chief Officer's report the work we're doing around care closer to home, taking that whole systems approach. And out of hours service delivery is a key aspect of that. Obviously, part of that is the GP out of hours service, but there are a number of other out of hours services, including out of hours nursing, our MEC services, for example. So we are doing a workshop with key stakeholders towards the end of April, bringing together the key stakeholders who do work in out of hours to think about what are the opportunities and challenges and how might we help to improve the overall service provision through a more integrated approach. So I think that's one of the opportunities that's arising through the integration of out of hours into the Health and Social Care Partnership. And again, we'll give you more information on that as that develops.
Gail, thank you very much. Stephen, you've got your hand up. Is that the legacy hand, or do you have another question?
No, I wanted to come back in, Michelle,
Okay.
in relation to the out of hours.
Sure.
Yeah, I mean, it's a national issue, clearly, out of hours coverage, and I would welcome a lot of the work that's going on, to look at it differently and integration. I do think that we need to be looking at it nationally, and that when we go to out of hours services, I think we need to lose our boundaries in terms of being able to support the whole of Forth Valley and actually even support out with that. And I think that's the direction that we're going on. The world's changing in terms of what some people quite like out of hours, and not just from medicine, but in emergency services as well. But actually, it needs to be a national discussion around about this. And it 6 o'clock at night or on the weekend, or when we switch to out of hours, boundaries we need to lose our boundaries going forward, I think.
Okay, thanks for that, Stephen. Okay, this is a paper that requires decision. So if I can ask you to go back to section 2 in terms of the recommendations, are you happy to endorse recommendations 2.1 to 2.5? I see no objections, so thank you, Councillor Hannah. I can hold the line. Say something.
I can tell the camera's not Zoom, just wondered if you might want to take an adjournment, we could move to another room and start the Zoom facilities.
Okay, I don't know if you heard that. We're planning to take a short break. Those of us in this meeting room here are being moved to another room. I think there's an issue with the camera in here, so that gives us a little break. You were going to get one anyway, so take sort of what, 5-10 minutes, Brian? What will we need?
Fine to do it, maybe 10 just.
Take 10 minutes, okay, and then go off, get yourself a cup of tea or whatever, and then we'll kick off with the second part of the meeting. Thanks, colleagues, for your patience. Yeah.
All right. I'm glad Gail came in the last one though. Because
Yeah.
I didn't know no, I do. No, I'm not very good at heights, so.
If it gets too much, I might just go out there. I can't take it anymore.
Just want to check that it's working.
Welcome colleagues and thank you back. We have moved room and I believe now sadly the Zoom is working, so our camera will zoom in on whoever is speaking, so that is grand. Okay, I'm now going to move us on to the next item on the agenda, which is item 7, and it's the 2023-24 business case. And again, I'm going to hand over to Stephen.
Thank you, Chair. So as part of the IJB's integration scheme, a business case is prepared each year to determine future funding contributions from partner organisations and to determine the budget for the new financial year. The first draft of the business case was presented to the November IJB board meeting, and this report provides an update focusing on what has changed and what hasn't changed since the previous iteration. These changes are summarised in section 4 of the report. Section 4.2 notes that national funding will now be higher than originally anticipated. 4.4 notes that we were unable to reach agreement on the 2022-23 Scottish Joint Council pay funding, and consequently the recurring gap that requires to be met from savings has increased by £1.173 million, while 4.5 and 4.6 note other funding adjustments in respect of aids and adaptations and the Council's capital programme. So those sections focus on IJB income. Section 4.7 onwards then turns attention to IJB expenditure assumptions. A 2% pays assumption for Agenda for Change staff may seem low in the current economic climate, and since the report was written, we now know a much higher offer has been made for 2023-24. But the 2% was based on agreed budget modelling, and any uplift in excess of 2% should be funded by Scottish Government, as happened in the current financial year. For the SJC pay award, I've applied a 2.5% uplift, and this was consistent at the point in time with council pay modelling. However, the council did revise pay modelling assumptions after this report was written to assume a 5.5% uplift with a 2.5% assumed Scottish Government contribution, leaving a net 3% cost to the council. So this report has only assumed a 2.5% uplift, although it does note that a higher uplift would present a financial risk to the IJB. Section 4.8 illustrates the risk and notes that an additional 2.5% would cost a further £901,000, which the IJB would require to manage. Section 4.9 notes that we have increased the uplifts for social care providers slightly from the last time around, and this reflects the December Consumer Price Index information. The actual uplift that will be paid to providers depends to a large extent on national negotiations. And again, there is a risk that actual payments could be higher than what we've modelled, although we have tried to be reasonable as far as we can with our modelling, recognising the pressures our providers are facing and also recognising their own funding challenges. Section 4.11 notes quite a significant jump in forecast overspend pressures in the current financial year between the August and December forecasts, and we will require to manage these pressures next year. Section 4.16 refers to funding uncertainty regarding the Primary Care Improvement Plan. There has, since writing this report, now been further correspondence confirming we can expect inflationary uplifts to PCIP funding, but I think the devil will be in the detail and we don't have that yet. Section 5 provides an update on the strategic plan. It's essential that financial plans, workforce plans link to the aims and aspirations of the strategic plan, and the new strategic plan is later on today's agenda. That brings us to section 6, which summarises the impact of the changes outlined in section 4 since the business case was previously tabled. Table 1 shows that we now have a recurring gap of £13.493 million, that requires to be met from savings. This represents 5% of the budget and will be a formidable challenge to deliver this level of savings. That leads us nicely on to section 7, where the savings programme is summarised in table 3, with further detail contained within appendix 1. While the savings programme of 13.493 million fully meets the gap identified earlier in this report, it should be noted that £2.829 million of the programme is met from non-recurring reserve contributions. The use of non-recurring reserves is not a sustainable way of delivering financial balance, and alternative proposals will be required in future years to address the position currently. To put a saving of this magnitude in context, this would equate to a cost reduction of roughly £54,000 every week, approximately equivalent to a reduction of 2,466 hours of care at home each week, or 65 long-term care beds per week, or the closure of more than one community hospital ward. Rising primary care prescribing costs and the absence of social care inflationary uplifts in the context of a 7.5% pay uplift are of particular concern. Section 8 touches on the capital programme. Section 9 is the conclusions. So I'll just bring us back to section 2, where we have the recommendations. The board is asked to note the adjustments to the 2023-24 financial planning assumptions detailed in section 4, to approve the updated 2023-24 business case, and to approve the 2023-24 savings plan, including the use of £2.829 million of reserves to address the residual financial gap. Thank you, Chair.
Thank you, Stephen. Before I open it up, I feel I have to say this at this meeting, and I know I've said it at other meetings as well, that I am disappointed that we did fail to reach an agreement in relation to the pass-through of the funding for the SGIC award, and I know that certainly IJB colleagues did their very best to ensure that we didn't find ourselves in that position. However, I do appreciate there are wider things we need to be concerned with. So can I hand over? And is there anyone? Gordon, my first question is from Gordon.
Yeah, thank you, Stephen. It's a very good report if the position it describes is obviously not a good one, but the report is very clear. Can I echo what you said in relation to the council pay award, Chair? I know that well, technically the council had discretion not to pass that money on, but as I understand it, the letter from the then Deputy First Minister said he expected those monies to be passed through to IJB, so it is disappointing that we've had £1 million or so added to the shortfall on the way. I understand what difficult position the council was in its own budget setting. None of us are in a good position right now. The other point I would make about the overall position is the heavy reliance on savings to get to a balanced budget. On top of what Stephen's rightly said, around half of the savings requirement is marked as red in terms of risk. So there is very high risk that we will not, as an organisation, be able to achieve the savings that are there. And overall, for me, I think we need to reevaluate the risk in relation to finance, because I think it's currently rated as a 20 out of 25. Given where we are, I think that needs to go up.
No, absolutely, Steve. Is there anything you want to come back on in response to Gordon's points?
I'm not sure if I fully agree, Gordon. There's a challenge with the savings programme. A lot of the items that are red will be down to our capacity to deliver on savings, and some of that's to do with recruitment of staff so that we can actually take these areas forward. So yes, there are huge challenges here to deliver. In the current year, we found that where we weren't able to recruit staff, conversely we had savings from the staff, so that's how we've had these short-term savings. But we want to be in a sustainable financial position probably just now we're getting away with having non-recurring savings, taking up David's point from earlier, the investments that we want to make in a number of services, unless we get them in and up and running, then there might be further savings. So we do have I think a period of time where non-recurring savings are acceptable and appropriate, but we want to be in a sustainable financial basis. And absolutely, when we come to the strategic plan later in the agenda, we want to deliver for people in this area, so we need to have our money working effectively for us.
Yeah, no, absolutely, Stephen, thanks. Councillor Colley. Yeah, and probably on the same issue around the SJC award, and one of the things was around that would be good this year. I agree it was extremely disappointing, but yeah. But I suppose for Stephen and the team about when those negotiations will start, in terms, because obviously I think that the earlier the better in terms of having more discussions with the council, because I suppose my council colleagues will know this is an ongoing discussion around the budget and the budget for, obviously we're just into this year, but budget for the following year. And I suppose it's about having those discussions as early as possible, because certainly I would like to see any repeat of it, of that not being passed through, and we may have a situation where the government may clarify slightly better than they did around that. I know that Falkirk wasn't the only that made the decision, but I think in terms of the priority for health and social care, we need to make sure across, not just in Falkirk, but across the whole of Scotland, that our health and social care services are sustainable. And our biggest asset is our staff, and being able to make sure that is sustainable as well. So it was just a question, I suppose, to Stephen. So that was a lot of blathering, but to Stephen around the discussion, when will the discussion starts, and around next year.
Yep, sure. I don't know the direct answer to that, but I'm conscious that I need to have conversations with the directors of finance of both Falkirk Council and NHS Forth Valley in terms of this year and beyond the current year as part of the integration scheme. So that would sound like a good starting opportunity, just to highlight the update that was provided at the council meeting on a number of areas, and look to how we plan for both the pay award review, how we plan around the capital funding as well, and how we progress each of these issues. So I'm sure Gail also will want to take that forward with Ken and Cathy.
No, thanks, Stephen. I agree. For me, that wider concern is that we need to have a risk sharing agreement in place moving forward, not just something that's agreed every year. And Councillor Colley, you're absolutely right to point out that this was just for this time a one-off, but I do understand, and we've had lots of discussions about it, and I'm aware that most of us were unhappy about it, but it's the position that Falkirk Council find themselves in, but I just felt I had to say that in this meeting. So. Okay, we've got one other hand up, Frank, if you would like to come in.
Yes, my question is, when you're looking at savings and going back further, there have already been savings on the services that have been provided just now. I want to know, would like to know, sorry, if we are going to take into considerations what the day centres been, one of them being shut down because of the COVID, are they going to reopen, and is this finance going to be met? Because on next year planning for going forward, just try to save £100,000 off of day services. Day services on the learning disabilities, but it's day services all around. It's not just for learning disabilities, have been cut through the COVID. Now, what worries me, if we're going to get back the services back, that is going to put more strain on the fundings, because you'll have to fund it more and find the money for it. I know I cannot really just talk about learning disabilities on this side yet, because I really know more on that. The services and learning disabilities, they're only getting part time into day service. Some are only getting 1 day a week compared to 5, and some are getting a couple of days a week. They need the 2-day centres to open up properly if you're going to meet the needs that's supposed to be met. Whereas now, just now, it's just been Dundas, and this does put strain on carers, and it has been putting strain on carers for over the last couple of years. And you can tell what that thing with when they try and do an adjustment option, which I'll go further on when you get back on down to self-direct support. Bring that up, I'll speak about that. But this is where I'd like to know, is this budget going to get met? And where's the money going to come from to bring it back up to date? Or is the services going to be take £100,000 of what we already got?
Okay, Frank, thank you. First of all, I'm going to pass back to Stephen, and if he needs to, he can invite some of his other colleagues in to respond to the points you've made.
Thank you. So I will ask Martin to come in on this, because there has been a day service review that was undertaken before I started on this post. So Martin will be able to better answer on that. But I'm also aware that in terms of the budgets, we have not cut the budgets for Oswald Avenue or Dundas Resource Centre. They are both there. There is work going on just now looking at the options around our day services and what the future provision ought to be. But it's not been a financial decision. Obviously, the closure was initially triggered by COVID. There's actually been a burst pipe issue at Oswald Avenue too. So there's been various things, but I am aware that various officers, including Martin, have been looking at all the options around our day care provision. So Martin, if you don't mind, can I pass over to you?
Martin, before you come in, would you mind awfully if I invited Councillor Colley to come in first?
Thanks. I suppose just briefly on that, I was going to ask around the progress around the transformation of older people's day services. I know that was a key activity that we'd agreed, but I know that the capacity has been an issue in terms of progressing that.
Thank you, Councillor Colley. Martin?
Actually, that was exactly what I was going to say. The review that we previously undertook was in relation to older adults day services, and some may remember that actually we agreed a new model that would focus on mainly independence and inclusion. That work's been progressing slowly over the past couple of years. It has been delayed somewhat by the impact of the pandemic. The review for younger adults day services actually took place prior to me even coming into post. So we haven't done any work in terms of reviewing that provision since. There has been a bit of joint working between us and Scottish Government and a couple of other partnerships looking at future models for services for younger adults, particularly looking at increasing day opportunities and I guess much more community integrated opportunities for people going forward. But that is a separate piece of work, and it was never intended to have a direct impact on any of the services we provide currently, but was more around reviewing future models so that we could then engage with our service users and communities around the best way to develop services going forward. In relation to reopening services, again, part of that has been delayed by the impact of the pandemic. Part of it's been delayed by the pressures that we have around staff and resources, and the fact that we've had to pull staff from Oswald Avenue to actually support delivery in Dundas Day Centre. We do plan to take forward the review of Oswald Avenue and our other buildings-based services, but that work hasn't commenced yet. So unfortunately, in terms of when will we be reopening services, I honestly can't say just now. We've still got a significant bit of work to do around that. What I had hoped and what I had asked staff to do was review everybody that had previously received services in Oswald Avenue and Dundas to look at were there alternative options based in the community that could actually give them better outcomes, and I guess build on that model around community integration, but actually taking some of the elements of the older adult review in terms of that promotion of independence and inclusion. And I would hope that that work had progressed and actually involved all the families that had previously accessed both Oswald Avenue and Dundas, so that nobody should have lost the service, but actually people may be getting a slightly different service. And as I said, we still have the work to do around reopening Oswald Avenue, and that will involve engagement with a whole range of families and service users and other key partners. But that work hasn't progressed yet, and we've not really been in a position to make progress in relation to that, given the other system-wide pressures. I guess just picking up Stephen's point, we didn't attach any savings to any of the reviews of services that we undertook in relation to day opportunities. And our thinking was really, if we do identify savings, we will invest those and reinvest those actually in community-based services that promote that integration, that really early engagement. And actually what we would hope would be that we could create services that actually include people from as broad a span across the community to actually help support services. So it was always a thought around, if we identify any savings, we will reinvest it to grow our services at a real grassroots level, so that people can access services at a much earlier stage and actually can access really high quality services across a whole spectrum. So hopefully that gives an update in terms of the position, clarifies some of it. I know it doesn't give you a direct answer around when will we be reopening services, but hopefully it gives you an overview of where we're at. Thanks.
Martin, thanks for that. That's really helpful. So unless there's any other questions, I would propose that we look to section 2 in the report, which is the recommendations, and is the board today happy to approve items 2.1 to 2.3 in terms of the recommendations? Thank you, Councillor Hannah. Let's move on to item 8 on the agenda. We've got Stephen again. So Stephen, item 8 is the strategic risk register. So I'll hand over to yourself.
Thank you. So the strategic risk register is presented at each of our quarterly audit committees, and today's report was shared at the audit committee earlier this month. So apologies to Gordon and others who have already seen this. The strategic risk register is also reviewed regularly at the senior leadership team meetings, and it comes here twice each year. One new risk has been added to the register since it was last year in September, essentially splitting the primary care risk into 2 separate items. The primary care risk information is supplied by the NHS board. It should be a replication of information presented to ITIB Forth Valley committees. NHS Forth Valley committees, I beg your pardon. So in terms of the current risk register, we've got 10 risks, 9 rated high risk, 1 medium risk. The table in section 4.1 over the page provides an overview of these risks, with full detail contained in Appendix 1. Appendix 2 contains the risk assessment scoring matrix. Each risk has been reviewed in detail, and section 4.3 contains a number of bullet points which just highlight some of the key considerations when we've been reviewing each of these risks. I'm going to just talk briefly about Appendix 1. I appreciate that in the hard papers it's small and it's actually easier to read online, but I think it's helpful just to have a brief overview at least of what's in here. So there is a separate page for each of the 10 risks, and each page starts off with an introductory narrative explaining the nature and consequence of that risk. There are then 3 different risk scores on each page: a risk rating as if there had been absolutely no controls in place, a score based on current controls, and finally a future score assuming further controls are enacted. For each of these further control actions, there's an owner and a target date. And then finally, at the bottom of each page, there is a note of when the risk was last reviewed and an overview of what was considered during that review. Most of the review dates, if you're looking at the detail, are either late January or early February, and that's reflective of when the reports are prepared for both here and pre-agenda prior to this. So hopefully that, I don't think I'll say any more, so I'll just go back to the recommendations if I may. And it's to ask the board to consider and comment on the high-level summary of the strategic risk register presented in section 4.1 and to consider and comment on the detailed strategic risk register in the appendix. Thank you.
Stephen, thank you very much. Do we have any questions or comments for Stephen? Councillor Hannah.
Quick, very simple. On page 133, we've got current score and target score of yellow. Is that supposed to be amber?
Mine are in black and white.
I was just guessing that it was supposed to be amber, but I just want clarity. And 137 as well, the one that's yellow.
Okay.
That's just the way it's printed out. Can you see on yours? Or yours? It's the printer just run out.
Maybe the
133 was amber. And 137. Also amber. And that's the yellow one there. Well, that's
Okay, so we have enough with that, Councillor Hannah. Yes, we think it's just the quality of the printer. Okay, I can't see any other hands up, so with that in mind, are we happy to accept the recommendations 2.1 and 2.2 in this paper? We are, thank you. Okay, that takes us on to the next item. Gosh, Stephen, it's you. Item number 9, medium-term financial planning 2023 to 2027.
Thank you, and you will be pleased to know this is the last of the report for me today. Somebody else can get a chance. Okay, so you've probably gathered from the finance reports that we've already looked at today that so much has changed even just in a very short period of time, and so perhaps it's questionable why we produce a medium-term financial plan that stretches over a 4-year period when there is so much uncertainty, but actually that's precisely the reason why a medium-term financial plan is needed to better help us understand the challenges ahead of us during volatile times. So in terms of the covering report and the plan itself, the medium-term financial plan covers the 4-year period from 2023-24 through to 2026-27. You may recognise many of the 2023-24 figures as they're the exact same as the ones from the business case that we've just looked at. The executive summary in the cover report and the plan itself both stress the importance of aligning the medium-term financial plan with both the workforce plan and the aims and objectives set out in the strategic plan. And it's our intention that after today we will have a board development session to further explore these links. We can also reflect on the latest position in terms of due diligence and other recent developments. The cover report background notes that part of their review of the 2021-22 annual accounts, external audit recommended that longer term financial planning should be in place to support delivery of the strategic plan, and today's plan is the first step in what should be an iterative journey. There is scope to further improve the plan as we move along each year, and we will refresh the figures within the plan so that the plan remains relevant over time. Section 4 of the cover report outlines the purpose of the medium-term financial plan and provides an overview of its structure and flow. The plan itself begins with an introductory section before looking at the national context, with particular reference to both the UK Government and Scottish Government expenditure and economic forecasts. There is some correlation between the two, and we've reflected the combined inflationary assumptions in our longer term modelling. A number of the key economic messages are equally consistent, and it is clear that there's a need to reset public services. The national context also includes a brief section on Audit Scotland overview reports, and I'm just going to quote from one part of the plan, where it says, while the financial health of the Scottish public sector has benefited from short-term COVID funding, the common message across each of these Audit Scotland reports has been the non-recurring nature of COVID funding and the underlying recurring financial sustainability pressures that often existed pre-COVID, with a need to review and prioritise services and deliver recurring savings. And for me, it's just that last sentence that is a key message throughout the medium-term financial plan. The need to review and prioritise services and deliver recurring savings. The plan itself moves on to local context next, considering the financial strategies of both Falkirk Council and NHS Forth Valley, as well as the IJB's own strategic plan and workforce plan. The financial overview is in section 4 of the plan, and that shows that we need to deliver recurring savings of 13.493 million in 2023-24, as we discussed earlier in the business case. But it doesn't stop there, as there will be a continuing need to deliver savings throughout the period of the financial plan, and by the end of the period, we'll have required to deliver savings of £19.057 million to maintain a sustainable financial position that will allow us to support and deliver the aims and objectives set out in the strategic plan. The plan considers reserves and savings requirements, and concludes with short sections of capital planning and key financial risks. And I hope that in presenting this today, there will be a clear message for the board on our financial position and the challenges ahead of us in the medium term. So just back to the recommendations. The board is asked to approve the medium-term financial plan for 2023-24 through to 2026-27, and to note that a board development session will be held in April to consider the medium-term financial plan and due diligence applications. Thank you.
Stephen, thank you very much. Do we have any questions for Stephen? No. Stephen, you've either stunned them into silence, or I think it's more likely that I actually think it's a really good, clear report, and I think it outlines for me, and I'm only saying this because no one else will say anything actually, but I'd been thinking this, that it's very clear to me what the issues are, what we need to do, what the next steps are, so thank you for that. If we could just then go back to section 2 in terms of the recommendations, is the committee willing to endorse the recommendations 2.1 and 2.2? Because this afternoon, I think we're still in this morning. Thank you very much. Are we in this afternoon? Almost. Okay, Stephen, you now get a break. Thank you so much for all of those papers. That takes us on to the next item, which is item 10, which is the Falkirk HSCP strategic plan for 2023-26. And we've got Susanna this morning who will present this report.
Thank you very much, Chair. So the report today presents the draft strategic plan, which is covering the period 2023 to 26, and it's presented today for board approval. Just to note, the new plan's been developed with the strategic planning group, and their contribution has been significant and very much welcomed in shaping the plan that's presented here. And I would also like to note with thanks the contribution of the many people, our staff, communities, partners, who've provided their time and their views, as well as the team who have completed the work over the past year to develop this plan. The board will be aware of the requirement to produce a strategic plan, and this is for the integrated functions and budgets the IJB controls, and sets out our high-level strategic priorities. It should also describe how we will improve local outcomes and deliver our priorities, and also achieve the core aims of integration and the national health and wellbeing outcomes. So the process to inform the review and development of the plan is set out in section 4. I'll just cover some of those areas if that's okay with the board. This includes the production of a strategic needs assessment, and that in itself provides an understanding of health and social care needs of our population. It's been an extensive piece of work, and it's built on previous iterations of needs assessments and has been developed with our support from our LIST colleagues. When the national census data is published, we'll also do a separate analysis to inform some of our equality considerations and consider the findings and action accordingly. So the main issues and challenges identified in the strategic needs assessment will be very familiar to the board, and these are set out at 4.6. Notably, we have an ageing population, there's evidence now of widening health inequalities, we have economic pressures, our impact of COVID, and of course our workforce pressures that we've described previously and provided updates in terms of through the Chief Officer report and the business reports. In addition to seeking the views of the IGIB, our strategic planning group and senior leadership team through workshops and our board reports, we've completed 2 phases of consultation. The first phase was over September and October last year, and that focused on the challenges and priorities of the 2019 plan. This work then resulted in the development of a draft strategic plan, which was published as part of our second phase consultation in January and February this year. And a consultation report has been prepared and it's attached in the papers at Appendix 2. Overall, the first online consultation received 52 responses, the second 47 responses, and over 300 people were engaged through various meetings, focus groups and feedback sessions. So through the process of engagement, it's confirmed that the vision and the 4 outcomes from our 2019 plan remained relevant, and these are set out at 4.3 of your report. The 2019 plan had 4 priorities, and the consultation confirmed that 2 of these remained relevant, and those 2 priorities related to ensuring carers were supported in their caring role, and the second was to focus on prevention, early intervention and minimising harm, and that had a particular focus around health inequalities, mental health and alcohol and drugs. One of the priorities from the 2019 plan related to the use of technology, and this is now one of 3 supporting priority work streams in the new plan. The other 2 supporting priorities are around our workforce and communication and engagement. The plan has identified 2 new priorities in response to feedback. That was around one of our existing priorities being too broad. And that priority was to deliver local health and social care services, including primary care, through enabled communities and workforce. We also had a number of feedback, as I've noted through the consultation, that was put into themes, and that was issues such as access to services, person-centred care, workforce and communication. So in response to that, the 2 new priorities that have been developed based on that feedback relate to supporting and strengthening community-based services, and the second being to ensure people can access the right care at the right time in the right place. I would also just note that the priorities align with the Transformation Board priorities that have previously been presented to the board in September 22, and we'll just do some further work just to make sure they continue to be aligned. The strategic plan itself has a number of supporting and associated documents, and the board has received a report today on the medium-term financial plan, setting out the overall resources available. Work is ongoing to finalise the performance management framework to ensure we can report progress to the board and to our strategic planning group on the delivery of the plan, as well as the national health and wellbeing outcomes. And updates to the board will be through the performance monitoring report, which is a standing agenda item, and we would hope to bring that work forward in June. The board will also be aware of the workforce plan, which was approved in September last year, and a group has been established to lead, monitor and report progress on delivering this. We continue to work closely with our colleagues in housing services and contracts and procurement about the development of our housing contribution statement and the market facilitation plan, and again further updates will be presented to the board. We'll also review our participation and engagement strategy and our communication strategy over this year, with a review to refreshing both of those next year in 2024. At 4.26 of the report, we have set out work plan to develop locality planning for each of our 3 localities, and we'll work very closely with the locality managers and key stakeholders and local communities in the development of these. So alongside the development of the strategic plan, we have been completing an ongoing EPIA, so our Equalities, Poverty and Impact Assessment, and that's been done and attached to Appendix 3. This demonstrates the plan will have a positive impact on protected characteristics, with some exceptions, where no impact has been identified. Few adverse impacts have been identified. However, like we say, we'll keep this under review, particularly when this census information is produced. I would just note that Leslie MacArthur and Andrew Strickland have joined the meeting today and have provided significant work to develop the plan, and hopefully along with myself can answer any questions that you may have. So in conclusion, the board is asked to approve the strategic plan at 2.1 and to note the consultation report and the Equality, Poverty and Impact Assessment process at 2.2 and 2.3. Thank you.
Suzanne, thank you. Thank you very much for this plan, and to all of those involved. I do know how much work goes into these, and it's much more than what ends up on the page. So thank you very much. And before I open it up, I just want to say I particularly love the plan on a page. I think these things are fantastic and should be in all plans. So well done with that. Okay, we'll open it up to other colleagues. Any questions or comments for Suzanne and the team? Okay, we've got 2. First of all, Gordon.
Yeah, I would endorse again what you said, Chair. It's a very good plan based on an excellent process and a great deal of input there. I also particularly like the plan on the page, and the easy read version is also very good. It's both in terms of it being a good thing to do and it being a well-produced document. I think most of the comments I'd fed in during the drafting process have been taken account of, so thank you for that. That's very helpful. The one thing I would add, just in terms of detail, there is talk a couple of times about the mental health strategy 2017-2027 in there. That document is actually about to be superseded. That there is a new national mental health strategy due to be produced in spring, whatever spring means in Scottish meteorological terms.
July, probably.
I have been told that when the new First Minister reveals his first 100 days plan, that publication of a new mental health strategy will be part of that. So that is something we will expect to see quite soon. But from reading the strategic plan, I think the direction of both will probably fit together quite nicely.
Absolutely. Thank you, Gordon. So there's no real question in there for you, Suzanne. You're getting off the hook with that one, but I think just Gordon recognising what's going into that. And I don't know if there is a question. Actually, it might be whether or not it will be to do with timing before this is finally published, isn't it, as to whether or not the Scottish Government give a timeline or produce this new strategy.
Yeah, I mean, I know when you produce a plan that there is a point you have to publish.
Absolutely.
If you wait for something else to happen, you'll go on forever.
Yeah, you're waiting indefinitely, aren't you? Councillor Colley.
Well, at risk of I don't have a question either. Because obviously I've seen this as it's developed, and I think it's an excellent plan. I think the consultation on it and being able to really engage people and including the Equality, Poverty and Impact Assessment, I really like that there's mitigating actions where we've identified issues, and I think it is so important to have an easy read version and a plan on the page to make it as accessible as possible. So I think just a general thank you. It's an excellent document.
Okay, thank you, Councillor Colley. Councillor Hannah?
Yes, reiterate what's been said. It's a very, very good document, and obviously huge amount of work. So very well done. But being a bit of a nitpicker, I have I think what is quite important nit to pick. And looking at the plan on a page, which is the very useful thing on page 190. on the community-based services, it says that services will be enhanced to improve the flow of patients out of hospital settings and promote independent living. I wonder if there's maybe, now that the primary care services are coming into the partnership, if there's also something we can do about improving or rather reducing the flow into hospital settings in the first place, because it's at both ends that there's an important problem. That if there are ways in which we can provide community-based services that enable people to remain in the community and be treated in the community rather than having to go into hospital in the first place.
Okay, thank you, Councillor Hannah. Suzanne, do you want to start off? And I'm happy for you to hand over to one of your colleagues if you want them to fill in.
No, I think that's a very sort of helpful comment, Councillor Hannah, and that, thank you very much for that. I think obviously, like we say, we've brought this forward today in terms of for approval, but there's also opportunities if there are any comments. So we're happy to take back and have a look at that wording with the approval of the board. That, you know, if there's minor changes needed, that's acceptable.
Okay, thank you.
Thank you.
Stephen McAllister.
Thanks, Chair. Yeah, listen, I would endorse the quality of the plan. I do remember working in these types of things back in 2016 or so in Falkirk, and where it's the iteration where it's came from, and the strategic needs assessment round about it is, and it's very workable. It's excellent. The one question I have, and it is about unpaid carers, and our information and intelligence round about unpaid carers is still pretty weak, and of course these people save an enormous amount for the partnership as well, and probably do it with with a lack of real support. And I don't know the answer to this, but I'm wondering, what can we do to try and really harden up our information and knowledge on the actual number of unpaid carers we've got out there in order to try and support them, but actually to see what's coming up for our next iteration of this plan as well. I say I don't have an answer, but I'm just wondering what we're thinking about there, if we can do that.
Okay, thanks, Stephen. I know that the carer strategy is up next on the agenda, but Suzanne, I'm going to give you the opportunity to come back in and respond to Stephen.
Yeah, no, I think it's a good point, Stephen. I probably would have said that as well. The carer strategy is coming up. What I would say is we've worked very closely in terms of the development of the strategic plan and the carer strategy to ensure there's alignment there. We've also been looking at generally at the opportunities through the Liquid Logic system that's come in around sort of better use of the data that might be held there, if indeed it is held there, and also working closely with carer centres around numbers. I think also it's been really helpful having the communication strategy, and particularly our comms officer in post now, because I think that gives a real opportunity through our collaborative work with the carer centre and others to really push out the message of how we need to support carers as well, and what that can look like. So I don't want to steal Margaret's thunder, because I know she's done a lot of work around that, but it was just to assure that we have worked closely around that.
Suzanne, thank you very much. I don't see any other hands up, so I'm going to ask you to go back to section 2 of the report, which is the recommendations. Is the board this morning happy to accept the recommendations and endorse? So that's items 2.1, 2.2, 2.3.
Agreed.
Okay, thank you very much, colleagues. That then moves us on to the next item on the agenda. So that's item 11, which is the Falkirk Carer Strategy 2023 to 26. And I believe we've got Margaret Petherbridge this morning who will talk to the report.
Thank you and good morning, everyone. And thanks for the opportunity to come along and speak to you about the carer strategy. You'll see from the report in front of you that essentially what we're looking for is approval for the Falkirk Carer Strategy for 2023 to 26, which has been prepared. Sorry, I'm getting a bit of feedback. I can hear myself talking. So it's been prepared following consultation, and it's accompanied by an equality and poverty impact statement, assessment. We're also looking for approval for the statement of intent for unpaid carers, which we agreed locally we would publish this alongside the strategy. And as a result of any approvals that we get, we will seek to update the short break services statement to reflect the agreed outcomes within the strategy. So the background to this is that under the 2016 Carers Act, there's a requirement for local authorities to consult with unpaid carers and to publish a local strategy. The current strategy, which was published in 2019, was extended by a year. And that was to enable us, as we were emerging, which we haven't quite yet, from the impact of the COVID-19 pandemic. We wanted to make sure there was sufficient opportunity to engage with carers and to consult with them on what the new strategy should look like. And that's why, instead of bringing it to you last year, we're bringing it this year. It also meant that we could align it with a strategic plan, as that was also extended. The Scottish Government last year were also working on their national carer strategy, and that was published in December 2022. So again, it enabled us to look at what was published nationally and to make sure that we were aligning our local strategy with that. The draft strategic plan, as Suzanne has just spoken about, has 6 carer commitments and outcomes outlined within the plan, and we've aligned the carer strategy and the strategic plan around these 6 commitments and outcomes. Carers provided us with quite a lot of detail on issues that they would like to see addressed in the revised strategy. And there were 2 areas that they highlighted that they wanted us to work on with them. One of them is that we all know is that people are really impacted financially just now as a result of the cost of living crisis, and carers and care for people have always had issues around financial support and income maximisation. So that's one area. And then the other one that came out was maintaining the relationship between the carer and the cared for person. And some of that is around, you know, some of the issues that people have faced over the last 3 years because of the lockdowns, because of the health issues around COVID, etc. That's brought that to the fore. And we're looking at how we can support carers with that in partnership with the other people that are involved in supporting carers. So that brings me on to the consultation itself, and just to highlight that this was very much a partnership piece of work. We worked in really close consultation with the Falkirk Carer Centre and also the Carer Strategy Implementation Group. We carried out a public consultation between November and December 2022. We had 15 online responses to that, and from adult carers and parent carers, as well as 39 responses from young carers. And parent carers have emerged as a group that we want to do a bit more work with over the period of this strategy. As well as the online consultation, we worked really closely with Falkirk Carer Centre right throughout the pandemic, and through their carer surveys, through general feedback from carers as they conducted or completed the adult carer support plans and young carer statements, they gathered a lot of data, a lot of intelligence around what carers were telling them. In addition to that, our own Short Breaks Bureau had completed a carer survey asking carers their views on short breaks provision, which was really difficult during the pandemic and remains difficult as things have not yet returned to pandemic levels. And then we held a final consultation with the Carers Voice Group on the 15th of February 2023. We had some very specific sessions arranged for young carers so that they could engage through the Young Carers Project and the Carer Centre with us in a way that was best suited to them to enable them to provide their views. So we're also asking you to note the local statement of intent for unpaid carers, and that this and the strategy have been shared with Children's Services, just to highlight to them that the IJB is fulfilling its statutory duty to prepare a local carer strategy under the Public Bodies Joint Working Regulations in 2017. So, as I said, we're asking for approval for the strategy that we've put in front of you today. Once approved, the Care Strategy and Implementation Group will prepare an action plan, and we'll start to work through those actions to deliver on what's in the strategy. In terms of the statement of its intent itself for unpaid carers, this came out of the independent review of adult social care, and there's a strong focus in there in the need for support for carers and the need for that to be more consistent and intention to make it a right for carers to have a break from caring. So the Scottish Government and COSLA had published a statement of intent in March 2021, and that was updated in December 2022 and sets out commitments over the next 12 to 18 months. So the local statement of intent outlines the local intentions to support the joint statements that have been produced, and publication of that was agreed with chief officers, and so that's what's attached to this report. So in conclusion, we're asking for approval. We will develop an action plan, and we'll keep the IJB updated in terms of what that action plan consists of, how we're managing that, and any updates that we need to bring to you. In terms of resources, there is a recurring carers budget, and that's ongoing. That will support the implementation of the carer strategy. The proposals, we believe, will directly contribute to meeting the outcomes of the IJB for supporting carers. We haven't identified any specific risks in terms of compliance with the legislation. Any amendment to the current direction to reflect a new carer strategy will be completed. In terms of the equalities and poverty impact assessment, we've outlined in more detail within the conclusion of the report. I don't know whether you want me to go through that or whether you... No, okay, that's fine. And obviously the equality and poverty impact assessment is attached. So I think that's pretty much it from me, if anybody's got any questions.
Margaret, thank you very much for that, and also thank you to everyone involved in producing this report. Again, I know so much work goes into producing these, so thank you very much. I've got a few people with hands up already, so I'm going to hand over. We've got Frank Donnelly first.
Hi Margaret, it's a good report. I'd like to see what you really come up with, so I'm looking forward to reading what you do come up with, your own planning and what you want to turn in, how it goes forward. Okay, Margaret.
Thanks, Frank. Thank you.
Thank you, Frank. Next on my list, we've got Margot Biggs. Margot, you're on mute. You need to...
Right, I've got myself off. It's just to commend rather than ask, but I'm aware that there's been a slight delay in national developments on this, and I'm sure you're sort of waiting to see the outcome of these. But I think it's been a tremendous piece of work and very much an area which needs to be addressed. Thank you.
Thank you, that's really appreciated.
Thank you, Margot. Stephen McAllister.
Thanks, Chair. Yeah, just one sort of question of information of, I suppose, terminology around technology. We seem to use the terms technology and digital, and we seem to weave these together. I think they're quite separate. I think technology around about, say, remote monitoring of somebody, alarm systems are very much technically enabled devices that can support the vulnerable in our communities. I think digital is and I'm just trying to get my head around this for another organisation that I'm involved in the delivery of health and wellbeing services. So that's, to me, digital is kind of the use of apps, things of that nature. And I suppose I'd probably like to see as we go through this, scoping this out, yes, how do we use technology to support individuals, but actually what is our digital strategy as we go forward? Because I think they are quite separate. That's just my own view on that. People might disagree, but and the fact that we're interchanging technology and digital, I think potentially could be a little bit confusing, because we're talking quite rightly to make sure that we don't exclude people. So there's a bit round about how we don't make sure we don't do that if we're using digital services, but I think digital technology are a bit different. That's my only observation of the plan. Otherwise, it's a great plan. Thank you.
Okay, Stephen, thanks for that. And like you, I'm in and around these areas of work, but a point well made. Councillor Flynn.
Yep, thank you, Chair. Thank you, Margaret. An excellent report. This is an area which I'm really, really passionate about. I worked as a volunteer for well over 10 years with used to be the Princess Royal Trust for Carers, then became obviously Carers Trust as a young befriender and then a board member. And it wasn't the reason that I became a volunteer, but looking back on my own personal circumstances, when my wife and later on my daughter was ill, I didn't realise until many years later that I was a carer. I looked after them, but I didn't realise that defined me as a carer. So I never ever sought any help or assistance, because I didn't realise that was what I was, you know. And I think what you've described there is trying to reach out to people to say, look, is this you, you know, and we are here to help. And I think that's valuable. On the area of young carers, looking at the support in schools, you mentioned on page 359 that, you know, it's difficult to get the young carers to come forward, and the schools have, some are very good at making this connection with the children and that one, or the pupils rather. I'd be interested to know which schools, not today, but are very good, purely as a benchmarking exercise, and which aren't, and how we and yourselves can actually work with the schools that are maybe struggling a bit in communicating. Now, I have a 16-year-old son, and life is hard, you know, because if you ask him anything, how are things, it's no bad, that's it. You know, getting particularly boys to open up and talk about things is almost a thankless task. And certainly in mental health issues, you know, it's a kind of hidden condition where people will, for the sake of perhaps the family or that, will just shrug things off, you know. So I'd be interested in any innovative ideas for the future that you're looking to try and get these children, girls and boys, to come forward and open up, because quite often people, as you know, don't want to talk about their personal circumstances. You know, they shoulder a lot of care, you know, to avoid doing that. But an excellent report, and as I say, I'm passionate about this whole area, and anything I can do to help, I'd be keen to do that. Thanks. Thank you, Chair.
Okay, thank you, Councillor Flynn. We have Fiona Colley.
I suppose you'll know I really appreciate this report, and I think it's really excellent, and you know, the level of consultation as well, and I think you know, the statement of intent as well, that you know, linking in with the independent review of adult social care and carers and people with disabilities as well, really talking about what they wanted from services going forward, and obviously what's come out of that has been the National Care Service. So I suppose I've got a question around the National Care Service, I guess, particularly around short breaks, and I know maybe not everybody's aware, but you know, Falkirk has talked about nationally in terms of the Short Breaks Bureau and what an excellent model it is and how well it works. But I suppose it's that kind of, how do we locally within this strategy build that market shaping in advance of a right to break from caring. So that's probably one question, and the other is just a general comment around the targeting around parent carers, which I think is a really important area of activity. And I suppose maybe just a question about that connection with children's services, because a lot of the activity will be handled from Falkirk Council Children's Services, and I suppose it's just kind of understanding the link in terms of that improvement planning.
Okay, Margaret.
Thanks, Councillor Colley. In terms of the market shaping, I mean, we've learned a lot over the period of the pandemic in terms of what makes a short break for a carer, and how carers, you know, when other things weren't available to them, what would make the difference. We discovered in talking to carers that while we were trying to offer very flexible supports, and some of that is outlined in previous reports and in the strategy around even just creating safe places at home for carers where they can be comfortable and enjoy a bit of time out, as well as, you know, possibly being out and about, having replacement care for the person, or you know, a kind of residential. So we've engaged with, so Shared Care Scotland has got a market shaping programme on the go just now, and we engage quite closely with that. They are working with, I think it's 6 or 8 areas just now, to look at new ways of providing short breaks, new ways of bringing things into that kind of marketplace. And we are, although we're not we're not one of the areas, we're following that quite closely. And the other thing as well is that we are constantly trying to engage with providers, not just in our own area, but trying to identify providers out with the area where people may want to access short breaks. So people are not restricted to the boundaries of Falkirk. That's the way the Short Break Bureau has operated. The other thing that we're doing is trying to support carers and the person that they care for to have breaks together, as long as we feel that that's meeting the carer outcome in terms of them actually having a break, having a bit of rest from the routine of their caring role. And we use the Shared Care Scotland, and they've got a search engine which identifies accessible and supportive opportunities for breaks, and, you know, in terms of accommodation. We go to local authorities out with the area to see if we can engage agency care at location for carers when they're away on breaks. So there's a variety of things that we're doing to try and make sure that we continue to expand how we approach breaks to carers, and trying to be carer-led in terms of what they're looking for from a short break. So hopefully that kind of helps to answer that question. In terms of parent carers, I think over the period of the pandemic we've become a bit more aware, and parent carers have made us a bit more aware of some of the unique issues that they might face. And over the last year, as part of the work we're doing, because our team works on self-directed support as well, as part of that work we've been doing some very specific and focused sessions with children's services, from all children's services, not just with children with disabilities, looking at what each service does, what their pathways are, and how self-directed support, which is part of carer support, can become part of that pathway. And we realised with engagement with children's services that the issues for parent carers are in the mix with all of that. So we are actively looking at what we can do with children's services. There's a few suggestions on the go. We are hoping that at some point we'll get approval for a support officer that will work specifically alongside the SDS team, but also and the Short Breaks Bureau, but also based in children's services, to look at how we support young people with disabilities, but also other young people, for instance, young people leaving care, and also looking at the support for parent carers. And that will hopefully be encompassed in all of the work that we're doing as a team jointly going forward. I hope that is answered.
Yes, Margaret, I believe I have. Thank you very much. Councillor Hannah.
Thank you, Chair. I'd just say the same as others, it's a very good and very comprehensive report. And so well done for all that work, and it is a very important area. Carers are often forgotten about, so well done. There's a couple of things I'd like to say though for going forward. One thing I would like to say is I'd like to see a little more emphasis put on to the income maximisation side of things, because one of the biggest issues for carers is the loss of earning capacity and loss of ability to go out and work. And so there's a real importance on income maximisation, and it is mentioned, but I'd like to see a little more emphasis on it for the future. The other thing that is related to income maximisation, but also I'd like to see a bit more emphasis on, is you have often situations where you have mutual caring, where you have a couple and they are each, sometimes it'll be the man, or it might be the woman, or it could be anyone who sees themselves as the carer, but who actually has care needs, him or herself. Yeah. And often that's forgotten, and often that carer will minimise their care needs because they think, if I admit that I can't care for this person, then I'm admitting that they're going to have to go into some residential care or some other kind of care. So there's a really big important issue about both the carer and the person being cared for getting the support and the income maximisation and recognition of that mutual caring situation. It's just a suggestion for taking things forward. I think it's really important.
If I can answer the question about income maximisation first, we have in fact through the carer strategy monies, we have a dedicated income maximisation provision for carers, which is run by the Citizens Advice Bureau, but what they call them clinics, I think they are hosted within the carer centre, and that's been in place for quite a while. So there is a focus. We've maybe not brought it out so much in the strategy, but there is a focus on specific carer support for income maximisation, and even things like budgeting and support with debt, etc. So that is in place, and we after that was put in place, we actually increased the amount of funding to increase the number of hours that was available to carers, because there was a big uptake. I absolutely take your point on the mutual caring. We do come across situations often where the carer also has health needs, and in terms of how that's covered, that is part of the adult carer support plan or the young carer statement in terms of looking at the carer's health and well-being. We try and support that as best we can. Some of that is about actually helping carers to identify their own support needs, as often carers are so focused on the person that they care for, and we have had to have conversations with carers about making sure that they understand the difference between their own outcomes and the outcomes for the person that they care for. Although they're both very much related, carers are not good at focusing on their own outcomes and what would make a difference to them. And the other thing, that as a result of all the issues that carers faced during the pandemic, the Carer Centre identified, along with Falkirk District Association for Mental Health, that there were a lot of carers that were really needing access into counselling, but the waiting lists for general counselling were high, and so we have just recently agreed funding for a specific counselling service for carers to address some of the issues that they're facing. So that will be up and running shortly.
Thank you very much.
Okay, thank you, Margaret. Frank, you've got your hand up. Do you have another question, or is it a legacy hand?
No, I've got another question.
Okay, over to yourself then, Frank.
Margaret, on self-direct support, it takes a bit of time if you're going doing a care plan for self-direct support, where on respite is completely different. How is this going to meet the younger kids, the carers' needs? Because I know years ago, when we used to do respite, prior to respite getting set up within Falkirk area and New Holidays. One of the places I went and tried to hire was away up in Aviemore, and I was getting Army to give me a hand to turn around and do some activities with our members. And when I priced the charities what was charged me, we could not afford to do it. So when you're putting somebody through as young carers to get some respite or give them away a bit of holidays, some of these holidays are really expensive just to hire the place. Is that getting met or something like that?
So are you talking about young carers here and not young?
I'm talking about both sides of carers, because I know some carers like to do, some people would like to do abseiling and all that stuff. But
so,
when you go into the type of respite situations, they're very expensive, and I know the accommodation just for my daughter to go into accommodation, it outstripes what the respite, the limit she gets in respite sometimes. It's because of the price you have to pay for the building with the equipment. So you see where I'm coming from. It's the cost getting met for doing different things for the carers and for the people that they send away. For carers getting a break while somebody's going away, instead of going into a care home or a respite situation, they can turn and go somewhere else and do some activities. And it's matching the budgets to turn around and allow them to do that. That's what I'm coming from, Margaret.
Okay, thanks, Frank. Margaret, is that something you're able to answer today, or is this something that we need to get back to Frank on?
I would say it's something we're aware of and we're constantly trying to address, but with everything else, we've got finite budgets, and we're trying to get the best value out of the budgets that we have. And we will be, as I say, working right across children's services to look at all of the issues. But the thing about young carers is that young carers sit within adult services as well. They're often young carers of adults, as well as young carers or sibling carers of children. So it can be quite a complex area. And in terms of activities for young carers, the Young Carers Project does try to work on that with young carers on the basis of what they're asking for.
Okay, thank you, Margaret. Frank, are you satisfied with that at this point? Yes, thank you very much. Okay, I'm aware time is getting on, and I've already got people who are needing to start to leave the meeting. So with that in mind, I'd like to take us back to section 2 in the recommendations. We've got so 2.1 to 2.3. Are we happy to endorse those and approve the carer strategy plan at this meeting today? Thank you very much, colleagues, and Margaret, thank you very much for a fantastic piece of work.
Thank you.
Okay, that then takes us on to item 12 on the agenda, which is the annual report of the Chief Social Work Officer for 2021 to 22. So I'm going to hand over to Sarah, who will present that today.
Thank you, Chair, and good afternoon, everybody. So the Chief Social Work Officer annual report that's presented to IGB today is required by Scottish Government, and it provides an overview really of the statutory responsibilities that have been fulfilled by the Chief Social Work Officer during 21-22. So this report has already been presented to Falkirk Council. That was on the 14th of December. The report was approved there for submission to Scottish Government and for onward submission to the IGB today for noting. There was also an amendment agreed by elected members in December, which acknowledged the commitment, skills and experience of the social care workforce and continues to deliver services in challenging circumstances, and called on the Scottish Government to introduce a clear process for accreditation for social care workers to attract more people into this field by presenting a clear path for career progression. I've used the template that is issued to Chief Social Work Officers to support the production of this report. And by following that, it allows the analysis of all 32 Chief Social Work Officer reports to really see what those emerging themes are across the country. So although we don't have that analysis report yet, I expect to see that our local challenges that have been described in the report will be reflected in that analysis report. So we'll see the issues around demand, cost of living crisis, the impact that that's having on families and individuals, the legacy of the pandemic, and the decline in capacity that we have due to recruitment and retention pressures. I'll just briefly outline, Chair, some of the report. So section 1 of the report outlines the Chief Social Work Officer role in some detail, and it provides an overview of how the Chief Social Work Officer supports the governance of social work and social care activity via a number of different formal committees and groups. And obviously to be able to undertake these responsibilities, I have some kind of delegated responsibilities that Martin Tom supports with and other officers. The performance summary of services can be found at section 2 of the report, and that principally focuses really on the areas that are conferred directly as statutory responsibilities of the Chief Social Work Officer. Over the reporting period, social care and social work staff have continued to navigate really very different ways of working. You know, IGB has been really focused on those over the last 3 years. We've been working in, within enhanced testing routines. We've been working from home in hybrid arrangements, getting used to using PPE, and operating within frequently changing national guidance and having to adapt to an ever increasing workload. Despite the current context and the significant uncertainty that faces the sector, our social work and social care workforce, including our third sector and other partners, have remained really committed to providing services that are empowering and that are supporting and protecting local people, and I hope the report reflects that. Section 3 of the report highlights lots of other areas that are doing that supportive, protecting work, and how we are working alongside our service users to be sustainable and fit for the future. Section 4 illustrates our considerable investment in our workforce, and credit, I think, really must be given to our workforce development team, kind of unsung heroes often, who support that activity, and they are constantly staying on top of developments to make sure that we are focusing on all of the right areas. In a highly competitive job market, choosing not to invest in our employees' futures can really have a damaging impact on our ability to attract and retain staff. Committing to the development of new skills and capabilities amongst our employees can really drive up loyalty from our workforce and lead to a happier workforce who feel more satisfied, and that feeling of satisfaction absolutely transfers to the experience of our service users. So we're listening to staff to understand what matters to them. You know, we've got real pressures and issues around recruitment and retention, so we need to understand what are the factors that are impacting on attrition. We absolutely need to make sure that we're competitive with our neighbouring local authorities and our partnerships, and to be in the right place for all of that, there's been considerable activity, I can assure you, over the course of this year in relation to our pay benefits and career pathways for occupational therapists and social workers. Our long-term vision is that social care offers a rewarding career with opportunities to develop and progress, where staff have the right skills and training to deliver the highest quality of care, and where wellbeing is prioritised. Within the introduction to my annual report, I give my sincere thanks to our social care and social work workforce right across the partnership, the council, and all of the different organisations that work alongside us. In my opinion, they continue to go above and beyond, and they're supporting and they're engaging and they're protecting and just generally being available where they can to the children, adults and families across Falkirk. So, Chair, now I refer board back to the recommendations set out in section 2. I'm joined by Martin, should there be any questions. Thank you.
Okay, Sarah, thank you very much for that. So just to be clear, colleagues, this report is here for consideration and comment. We're not looking for approval or to be suggesting any changes, but I'm going to open it up if anyone has any comment they wish to make. Okay, it doesn't look like we have anyone, Sarah. I've actually put them off by saying that. I don't know if that's, oh no, Councillor Hannah has something.
I'll just
Okay,
say,
Councillor Hannah.
you have to recognise that we've already seen this report when it
Yes.
came up to Falkirk Council. We've already had an opportunity to comment, and I would just say very well done to all concerned. And the amendment that was agreed was about acknowledging that commitment of the staff and recognising it and applauding it.
Yes, no, absolutely.
So I think it's worth repeating.
Yeah, for sure. Okay, thank you then, colleagues. If we take you back then to the recommendations. Recommendations 2.1, 2.2, are we happy to accept those today?
Accepted.
Okay, and Sarah, thank you very much for bringing this today, and very much I think it's important that this committee do acknowledge the commitment, skills and experience of staff who are working within social care at this time. So thank you very much. Okay, that takes us on to item 13 on the agenda, which is the performance monitoring report, and I believe we've got Callum McDonald with us this morning.
Yes, thank you, Chair, and good afternoon, members of the board. So I'm here this afternoon to present the performance monitoring report. And firstly, I'd like to draw attention to sections 4.4 to 4.6 of the cover report, which provides an update on some of the developmental work around the performance framework, as well as an update on indicators that were impacted by our change of social work system last year. So there's currently lots of work going on behind the scenes to refresh our performance framework and also to identify and fill some of our key reporting gaps. And we will see the report develop over the coming year. In terms of the main body of the report, performance is reported up to December 22 where possible and with a year-on-year comparison. As before, there is a focus on exception reporting, and I'm now going to take you through some of the key areas highlighted in section 1 of the main report. The report highlights there are continued pressures around emergency department and emergency department 4-hour compliance and around delayed discharges. The December 22 compliance against the emergency department 4-hour access standard highlights a decrease in performance to 47.5%, and that's compared to 61.9% the year before. The delayed discharge December 22 census is noted as 44 standard delays, 26 sorry, was a question there? No,
no, Callum.
No, sorry, I just heard some background noise. Apologies. Apologies. So the December 22 census is noted as 44 standard delays, 26 guardianship or Code 9 delays, giving us a total of 70 delayed discharges at that December census. And the overall position remains under continual review, and sections 3.1 and 3.2 of the report provide further details, as well as some of the actions ongoing to support these areas. The report highlights the number of complaints received across both health and social work adult services, as well as the percentage of complaints responded to within timescales, and also some of the main themes of the complaints received. For social work adult services, 61% of complaints in the first 3 quarters of 22-23 were responded to within timescales, and for NHS services, it was 82.4 responded to within timescales for the same period. And the Clinical and Care Governance Committee continues to oversee complaints performance, as well as monitoring the underlying themes. For social work adult services, the overall sickness absence figure for the first 3 quarters of 22-23 was 11.1%, and that's a slight improvement compared to 13.1% in the equivalent period last year. For NHS services, the overall December 22 sickness absence position is reported as 8.31%, and that's compared to 6.45% in December 21. The report also details the latest position for waiting times for psychological therapies, and in December 22, 77.2% of patients started treatment within 18 weeks of referral. And that's an improvement from the previous month's position of 72.1% and also from 67.9% in December 21. In terms of recommendations, the board is asked to consider and comment on the content of the report, and to note that appropriate actions continue to be taken to address the issues identified. Thank you for listening, and I'm happy to take any questions or comments the board may have.
Callum, thank you very much for that. Okay, I'm going to open this up. Do we have any questions or comments for Callum? Gordon McAllister.
Yeah, one comment and a couple of questions.
Apologies.
I knew who
You're
you
not
were.
Gordon McAllister. You aren't Gordon, however. Apologies, colleagues.
So I know what you say about the report expanding and changing, Callum. I just note that some of the indicators around satisfaction are the ones that are missing, and I would hope we will be able to replicate them, because it's important we get those indicators in, as well as the more process-related ones, shall I call them. I see nods, so that's fine. The two more detailed questions I had, one in relation to absence management. I note that the absence figures in terms of the social care side are going down, which of course is good to see. In NHS, we've seen comparator figures with other boards that shows our absence stats as particularly high in relation to comparators. I just wondered what the position is in social care, whether that is looked at against the figures for other health and social care partnerships, because I kind of accept that the figure would be higher than the NHS figure, but simply seeing a figure of 11%, I don't know whether that's kind of an outlier in terms of the health and social care world, or whether it's about average. And the final point was in relation to the adult protection referrals at kind of indicators 45 to 47. The picture seems to show a much lower number of referrals coming through, but a higher number of investigations being carried out. Now, that may be a good thing, but I'd just like to kind of understand whether there is some sort of policy change behind that, or capacity issue, or whether it's just a kind of statistical anomaly that those figures happen to be moving in different directions. Thank you.
Okay, Callum, my colleague Gordon Johnson has two questions for you. They're able to answer both of those.
Yes, thank you, Gordon. So you're right, the comparison data for NHS absence is widely published. I haven't seen a similar comparison for social work adult services, but I'll take an action to investigate that and see if we can get that comparison. In terms of the adult protection data, we have seen some fluctuations there, and it is something that we are monitoring closely. And we did discuss the figures in advance with our ASP lead, Gemma Ritchie, as well, and with our performance lead, Roger Morden. So it is something we're monitoring and trying to see, is it just a fluctuation in the figures, and we'll continue to monitor that closely.
Thanks, Paul.
Okay, thank you, Callum. Margot. Margot, you're on mute again. I think you're still on mute. Margot, that's you now. Oh, no, Margot, you're back on mute. These things are annoying, aren't they? Right, you're good to go.
Just to say, it's an excellent kind of highlight of the issues, I think, and things like, delayed discharge, etc. Do you, in your process of responding to concerns, use care opinion at all?
So thanks, Margot. So care opinion is, as I think has maybe been mentioned previously, it is just coming in live into the partnership, and actually that links to Gordon's point about the satisfaction indicators that we're losing. So we're really very conscious of that. So we are going to look at care opinion and look to see how we can improve our reporting on customer experience. We're sad to lose those previous indicators, but I think there are opportunities through care opinion, and also Liquid Logic that we have brought in allows us to record outcomes for service users, and we need to understand that a little bit better, but it could potentially lead to opportunities to some more meaningful indicators around outcomes and experience. So we look forward to developing those.
Thank you.
Okay, thank you, Margot. Councillor Flynn.
Yeah, thank you, Chair. Just a few questions, really, just for my clarity. On the first one, on the key performance issues, with the emergency department information, obviously I understand 95% of patients should be seen or wait less than 4 hours. I'm not sure what the two figures of 47.5 and 61.9%, what they actually mean. A decrease in what? You know, does it mean that's the percentage of patients that were seen in that time scale, or what? You know, Callum, it just helped to clarify that.
Yep, of course.
Thanks.
Yeah, no problem. So yes, you are right there. That 47.5% was the percentage of patients that were seen within 4 hours.
Right.
At that time period.
Right. So it's quite a shocking performance, really, if you think about it. Not reflecting on yourself or anyone else, but compared to a 95% target, it really is extremely poor, isn't it? You know.
I think it reflects the pressures that are on the wider system at the moment, and we see similar figures across the country just now as well. So we are doing benchmarking as well.
Right. Okay. I'd be interested to see once the benchmarking comes out. And just a general comment, actually, it's maybe just me, where it quotes percentages of patients, you know, and any of the numbers, obviously some of them are difficult. It would personally, for me, be useful to know how many patients we're talking about. Like psychological therapy is 77.2% of patients. Now, is that of 1,000 patients, 100 or 10,000? What the actual number of patients was, because that would give it a better hands-on feeling what the issue is or the positivity is. Does that make sense? You know, because the numbers could vary so much, but you couldn't do it for everything. But I think you know, you've registered the complaints and actually said 79 complaints with 61% and actually shown the number. I don't know what you feel about that, Callum, but it would help me to know what the real numbers that we're talking about.
No, I think that's absolutely a fair comment, and I think that's important context. So again, I can go away and make those changes and add them in for next time round.
That's great. Thank you very much, Callum, and thank you, Chair. Thank you.
You're welcome. Thank you very much, Callum. David Heron next.
Yeah, thank you. Just picking up on what Councillor Flynn said, which I think was a good point around ED. I think Callum kind of highlighted it's also just important to recognise that that's not a sign of the care delivered in ED. It's a sign of the wider system pressures, because a lot of the time the problem in ED is they can't move the patient on further down the system because there's no beds to move them to. So it's a sign of our hospital not having enough beds for inpatients. And I think it's probably just in the same theme highlight 42 and 43 are around the readmission rate. And unfortunately, that seems to have got worse rather than better over the last year. And again, there's a pressure. 6% of our patients are going back into hospital within 20 days of an admission. And there's such a pressure to get people out of hospital that potentially they get sent out and end up back in because they're not well enough to leave ultimately. And also, I think I've highlighted before at meetings, but patients come out of hospital without a discharge letter. And if patients don't have a discharge letter, it's very difficult for them to manage their own condition. And it's very difficult for us in the community to manage their further follow-up when we don't have a discharge letter. Now, I know there's work going on with that. There's a lot of hard work going, but still that is a problem. And that's why I think the readmission rate's getting worse. So just thought it was worth mentioning both these points. Thanks.
Okay, David, thanks. Gail, are you looking to come in on that issue?
Yes, I was here. Yeah, just to build on David's point. So in terms of these key indicators, they are whole system indicators. So it is it's a complex system in which we work and a range of different factors impact on the performance in different areas across the system. As part of the weekly performance review meetings, I mentioned that we've been taking place across the whole system, including ourselves, Claxon Stirling, Health and Social Care Partnership, and colleagues from the acute hospital. We are focusing on a number of indicators, and we're going to be moving on to focusing on the performance of the 4-hour standard, noticing how that performance changes over time and what's happening that's different in the system that's impacting on that change to help us focus on doing the right things at the right time to help that overall indicator and that overall system pressure.
Thank you, Gail. Councillor Flynn and David, are you happy with that? Anything you wish to come back in on? No. Okay, what I would like to do then is to ask the committee to go back to section 2 in terms of the recommendations. Are you happy to note and agree recommendation 2.1 and 2.2? Yes, thank you very much. And Callum, thanks very much for that report today. And I particularly look forward in the coming, so say, year or so to see what we can get out of Liquid Logic. Okay, that takes us on to item 14 on the agenda, which is the IGB governance report, and we have Suzanne Thompson who will present this today, I believe.
Yes, thank you again, Chair. So the report provides an update on a range of relevant matters to the board. As you've noted earlier on, Chair, some of the changes to the membership, but just to recap for the purposes of the board paper, firstly, council membership, which has been confirmed following the council meeting on Wednesday this week. Councillor Colley has been appointed as chair, and following the resignation of Councillor Devine, Councillor Jim Flynn has been appointed, and Councillor Anne Handa also continues to be an IGB member. NHS Forth Valley has appointed Stephen McAllister as Vice Chair of the IGB, and the current NHS board members are reappointed. All of these appointments are effective from the 30th of April. In relation to our Executive Nurse Director, that's been confirmed as Frances Dodd, who will be the nurse representative on the IGB and the Clinical Care Governance Committee, with Elaine Kettings acting as our substitute. So all members, new and returning, are very much welcomed to the board. In relation to the Register of Interest forms, we've just provided an update that, with thanks to all board members, that these have been completed and they're now published, and that's in compliance with our Code of Conduct. For new members, today we'll make contact to ensure this is also done. The report notes the ongoing work and timescales to review the integration scheme as set out at section 7. And finally, the board is asked to approve the refreshed volunteer expenses policy, and that's attached to Appendix 1 and 2. I would just like to note that there are no major changes to the policy, and this was due for review, and it'll ensure we have a policy for carers and service user representatives' involvement in the work not just of the IGB but the wider partnership. So in conclusion, the board is asked to note the recommendations at 1.2 through to 2.6 and at 2.7 to approve the volunteer expenses policy, and happy to take any questions.
Suzanne, thank you for that. I am particularly pleased to see that we've got we're making some headway in terms of the review of the scheme of integration. That is good, and I know that COVID and such like got in the way of that, but it's good that we finally have some time and resource to do that. Do we have any other questions or comments in respect of this paper? Councillor Colley. Yes, congratulations, Councillor Colley. Thank you very much for
I thought that this seemed an important point to say thank you to you for a number of years of commitment as both chair and vice chair, you know, and particularly throughout the pandemic. And I think I want to take the opportunity to say thank you and for the excellent work and leadership within the IGB. And probably just to note to everybody, and you can see that in the paper, you're not leaving us, and we'll still benefit from you being a member of the board. So I wanted to take that opportunity to do that formally, and that's the main.
Thank you very much. It's been an interesting time for us all, hasn't it? So, yeah. Okay, with that in mind, I can see no other hands, so we can go back to the recommendations. So we're happy to approve items 2.1 to 2.7. We are, thank you very much. Okay, that then takes us on to the next item, which is item 15. So public sector equality duty compliance. Suzanne, that's you again, I believe.
Yes, thank you again, Chair. So the report presents an update on our ongoing improvement work to ensure compliance with the public sector equality duty and our Scottish specific duties. The board has received updates on our ongoing work, and that's to address that compliance concerns following a receipt of a letter we received from the Equality and Human Rights Commission, which was also sent to all chief officers in June last year. But specifically in terms of compliance, Falkirk Integration Joint Board was required to firstly publish a mainstreaming report, our set of equality outcomes, and report on progress made against our existing equality outcomes. And in November last year, the board approved the Equality Outcomes and Mainstreaming Report for 2022-23 and a progress report in terms of our previous document. And that has met the requirement that we were asked to do. Further work is set out in the report at section 4 about our plans to develop and consult on a new set of equality outcomes for 2023-24. We are developing these outcomes in line with the Equality and Human Rights Commission guidance, and this does involve significant work, including research and specifically participation and engagement with groups. So this will ensure we develop our targeted outcomes that will then be subject to wider consultation, and we intend to bring a report back to the board in September 23 for consideration and approval. In addition, the Commission also required us to have a process in place to ensure that all our decisions made by the IGIB were appropriately impact assessed and that these are published in an accessible manner, and that was a requirement to let them know of those arrangements by today. So the senior leadership team has agreed that we will use the Council's EPIA system and processes, and that is to log, complete, but importantly for us to have an ability to keep an electronic record in one system for all completed initial screening and full EPIAs. We've been doing some work to look at a refresh of our Health and Social Care Partnership website to ensure ease of access to our equality impact assessments and other related publications. And we've also been developing guidance and support to officers and to the board, and that further updates will come to you. In summary, good progress has been made, and we will be writing today to the Equalities and Human Rights Commission to respond to their request for a progress report. And in conclusion, the board is asked to consider and comment on the report at 2.1 in the report. I'm happy to take any questions.
Thanks, Suzanne. Do we have any questions for Suzanne? Councillor Hannah?
Not so much a question as a commendation. Okay. I'm actually very pleased to see that within the agenda today there are a number of equality, poverty and the impact assessments. It's an issue that I think is really important that is done in relation to everything that we're doing, and it's also important that it's publicly available and that it's transparent. So well done for those who have done the EPIAs and have included them with their reports. It does make the papers rather larger, sadly, but it's important information. So thank you very much to all who've done that.
Yeah, no, absolutely is, and I agree with you 100%. Any other questions or comments? I can't see anything, so with that in mind, then just go back to the recommendations. So is this board happy to accept the recommendation in 2.1 in the report? Thank you, Councillor Colley. You've put me off my track by being too nice. No, you're always nice to me, but I don't like all that touchy-feely stuff. I know. Okay, for sure. Okay, I have to pull myself together. Okay, item 15 on the agenda is the HSCP comms update, and I believe we've got Paul with us this afternoon to present this paper.
Yes, hello, thank you. And thank you, Chair. So I'm pleased, as usual, to be presenting the standing item on the board, which is a quarterly communications update providing a summary of activity from across the services, and it also demonstrates how we're implementing the partnership's communication strategy. So to begin, the report provides a summary of media coverage. So over that last period, that's included 30 pieces of media, over 300,000 opportunities to see across our key publications of the Falkirk Herald, Daily Record and Falkirk Live. We've had over 53,000 impressions via social media, and separately we've had over 110,000 impressions through our paid advertising, which has included a Sky AdSmart campaign and some radio advertising. So the report provides an update of communication pieces which support various services and developments from across the partnership. I'll not cover everyone in this verbal update, but I'll pull out a few key ones. So of course, one of the key pieces of Cornerstone communication activity has been the careers campaign. So a few key things to pull out from that: our social media content. We've had over 200 shares from partners, elected members and staff especially. So a big thank you for helping us spread and promote careers within the partnership. We have run for the first time a Sky AdSmart campaign, which is a targeted TV advertising. It's served over the internet to Sky and Virgin boxes within the council area, so it's extremely targeted and provides value for money in that term. And that ran for 30 days in the run up to the Christmas period, and resulted in that 100,000 paid advertising reach. And that was promoting roles across the partnership, but mostly home care, and signposted people to the website and the new careers page. We've also recently run an 8-week campaign on Central FM and participated in the Scottish Government's National Adult Social Care Recruitment Campaign, which I know many of you might have seen that one of our home care team, Arlene, has featured heavily in that, and our case study has featured online, in press and in radio work. So I'd like to really thank her for contribution and enthusiasm for taking that work on. I certainly know that she was a bit nervous about taking on the radio work especially, but she's been really pleased with the outcome, and she says that she's had people come from all works past lives to say, "Oh, I heard you on the radio, it's fantastic that you're helping promote it." So a big thank you to Arlene, and that is just one of many case studies that we're working on at the moment, and we'll continue to develop those as part of the careers campaign. And just to add that all of that sort of pushes towards the website, where you can read more about careers and apply. So over that period, we've had over 1,700 visits to the careers page, which I hope you appreciate is a significant number in terms of the usual traffic that the partnership website receives. And in fact, that over 40% of visits to the partnership website now involve a visit to the careers page. So it seems that we're targeting correct audiences. And I did hear that Gail stole the thunder a bit in the beginning of the meeting in our Chief Officer report, and shared those positive stats that show that we've had an increase in applications to home care teams and an increase in successful applications, which is positive news. I'd like to also highlight the Community Choices Participatory Budget Programme, which is now it's in its third year. And over the last quarter, voting was open, and the promotion that myself and colleagues in Falkirk Council Comms have been working through has resulted in a 37% increase in votes received for that. So there's some exciting health and social care focused projects in those that have recently been awarded funding. So that includes the development of a new changing place facility in the Upper Braes. So I look forward to helping share some of the news from those projects as they come to fruition. And then a couple of smaller but nevertheless important pieces that are in the report, just highlighting our participation and promotion of Older People's Day, which happened last year, and also utilising the traditionally quieter media landscape between Christmas and New Year to highlight adult sport and protection progress, training of champions, etc., that we were able to utilise. So that the coverage is in the report. I encourage you to have a look. And then just to flag some media issues which have sort of come up over the past quarter, which of course a lot of intense interest in the NHS Forth Valley escalation, discussion through various different boards, which has resulted in media coverage, and of course in the cost of living, so fuel poverty and household costs, with the partnership's Health and Inequalities Wellbeing Fund being acknowledged through a number of different council meetings, which has resulted in media coverage and elected members highlighting it as a positive way of rising to this challenge within our communities. So at the end of the document, there is a complete list of articles and headlines with online links if they're available for coverage during the period if you'd like to see. And the report also includes a short note about upcoming activity. So, of course, with the publication of the strategic planning carer strategy today, it doesn't just sit on the shelf. There is a bit of comms activity that we'll need to do to promote that, especially internally, just to show the progress of it and outline the vision that we're going to be working towards. And perhaps to pick up on Margot's question earlier, next week we're also launching the Care Opinion platform, which begins a phased approach. So next week we begin with social work adult services from the council, services delivered out of community hospitals and community nursing that will be available on Care Opinion. So there's a bit of comms work that you'll be able to see within the next week and beyond over the summer. And then it would be remiss for me not to mention our careers campaign and the recruitment event, which we are hosting next week at Falkirk Trinity Church, Thursday, 6th of April, 10:30 till 2. So that is also upcoming, and I hope you've seen some of the promotion around that. So lastly, just to go back to the recommendation, an easy one, which is just to consider and comment on the content of this report. Thank you.
Thank you, Paul. As always, I find this a really informative report. Just, you know, it's the one place that captures all of that activity. And also, like you, I would like to thank Arlene as well. It's not always, you know, it can be hard putting yourself out there, I guess is what I'm trying to say. So well done to Arlene. Do you have any other questions or comments for Paul? Gordon?
Just quickly, Paul, to commend you on all the work. It's, you see these things kind of dripping through here and there, but when you see them all together in one report, you realise what an enormous amount of work there is there. So thank you. Yeah, no, absolutely. Even for someone like me, and I'm, well, until today, I'm only the chair of this, but to actually see an ad on TV or something, it's like, you know, you feel sort of a pride in being part of that as well. So absolutely. Okay, any other questions? No? Okay, with that in mind then, if we cast our eye back to recommendation 2.1, are we happy to accept? Apologies, Margot, sorry, I didn't see you put your hand up.
No, it was just a quick commendation, and I think it's very valuable both from the organisation's point of view to have the highlighting of career opportunities, and it's tremendously important for service users to have a platform on which, with Care Opinion, they can identify issues without complaining or trying to allocate blame. So thank you.
Thank you, Margot. Okay, so recommendations then, are we happy as a board to agree the recommendations, which is to consider and comment on the content of the report in item 2.1? Agreed. We are. Thank you very much. Okay, so that brings us to item 17 on the agenda, and there are times like this sometimes where what we do is we deal with some business where the public are not involved in that. So essentially we exclude the public, and that's usually when there's a business matter where we're going to be discussing people other than the council, the health board or the HSCP. So today, if members agree, I'm proposing that item 18 be dealt with in a private setting. Do all members agree to that? Thank you very much, colleagues. With that in mind, then I'd like just to take a minute or two to allow Jack to do the necessary to ensure that we are indeed meeting in private to discuss this matter. So Jack, I'll wait until you tell me that we're good to go before I introduce the item.